You're unmuted.
Thank you.
You showed me, so I
I
just
didn't
kept moving.
move you, Tammy did. He just obeys.
Tammy did that, huh?
Yes, I did.
Ready? I'd like to call this meeting to order, Benzie County Board of Commissioners. Today is November 14th. I'll say that again. Today is November 14th, 2023. Roll call, please.
Cunningham? Here. Janot?
Here.
Markey is excused. Nye? Here. Roloffs?
Here.
Sauer?
Here.
Worsakki?
Here.
Please stand for the invocation and the pledge of allegiance. Dear Lord, thank you for the opportunity to serve the citizens of Benzie County. I ask for your guidance with the decisions we'll make today. Please keep all of our public safety personnel safe and free from harm. I ask this in the name of your son. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated. Today's agenda in front of you. If there are any additions, questions.
To approve the agenda.
Cunningham second.
Motion and support. Is there any discussion? All those in favor say aye.
Aye.
Aye. Opposed? So moved. Of approval of the minutes from October 24th, 2023.
I moves to approve as presented.
Awesome.
Motion and support. Further discussion? All those in favor say aye.
Aye.
Aye. Opposed? So moved. October 30, 2023, special meeting.
I had spoken with Commissioner Janot. There was a couple changes we made, but they're reflected in these minutes.
Thank you.
Janot, some moves. Second.
There's a motion and support. Any discussion? All those in favor say aye.
Aye.
Aye. Opposed? So moved. Brings us to our first public input. Is there anything anybody'd like to share? Comments, questions? Close public input, move on to finance. Approval of the bills. Thank you, Michelle.
Thank you.
Thank you, dear.
I am looking for approval of the bills in the amount of $948.79.
1 million.
Sorry. Let's do a do-over.
Let's do the 1,000. I like that.
$1,859,948.79. That's my number. Thank you.
359 or 356?
350.
79.
It's a tough one.
But this one's, I don't
Here, let me pull it up in the packet.
Ellie, you want a cup of coffee?
1,356,948.79.
I'll move that we pay them.
Sorry about that.
Yeah,
You get the 6.
this is in the packet.
Typo.
This was Shelley just had a typo.
Okay.
I got the sense right.
All
You did.
right.
You got everything but one number.
Sorry.
I do have a motion.
I'll second.
Thanks, Gary.
And here it's 59.
Motion is supported. Any further discussion? Roll call, please.
Janat,
Yes.
Nye,
Yes.
Roloff.
Yes.
Sauer,
Yes.
Worsakki.
Yes.
Cunningham,
Yes.
motion carried.
So the land bank is looking for round three funding, projects. We have $500,000, up to $500,000 that we can spend on a renovation of existing inventory. To create low to mod housing that's or less of AMI scale or 60% or less of AMI rent. There's also an acquisition feature, so if there is the ability to purchase an older home that needs help, we have that available as well. Because the county is one of 4 counties in the state above the federal guidelines for AMI. We could have done demolition and other stabilization and other things, but we're not eligible. So if anybody has any projects, I would like to spend that money. I have until March 31st to present a project.
Billy, do you have any thoughts of your own on
For projects.
for a
for it.
project?
The land bank owns a house in the village of Benzonia, and we are in the process of determining whether or not to use the demolition funds that we have remaining from round 1 or to use it in round 3 for renovation. So I have a meeting on Thursday with a company to determine the structural viability of that building. If it is viable, we're gonna renovate it and sell it to low to mod.
I was thinking the other day, and I want to make sure you publicly get credit for this. A lot of people don't understand that housing project in Honor wouldn't have happened without your initiative, so I appreciate you doing that.
Thank you. I went to a housing summit a couple weeks ago in the city of Traverse City. And the city of Frankfurt came to because he is Josh Mills is a member of Housing North. And so they were talking about the projects in their counties and what they're doing and how it works. And he never mentioned the land bank. And I said to the gentleman sitting next, which is white, that who asked me earlier why the land bank has such a small presence in housing. It's because we're the land stock. And once you get the land, then all the bells and whistles happen. And then you get the pretty package at the end. And the package at the end gets all the credit. But if you didn't have the land, you wouldn't have the package. And he said, fair enough. So he talked to Josh Mills, and Josh profusely apologized for that and put me in his notes for his next speech. But it was interesting to be at that meeting because NISTA was there, MADC was there, Rural Development was there, and Land Bank was there. But everybody was like, what's the land bank? We're at the very beginning of the project, so soon, but by the time the project gets its funding and gets on the ground, it's been 3 years. You forgot the land bank started the project. So thank you for putting us back on the list.
Let me ask a question. If we go to our townships and we share this information,
Hmm.
the townships per se aren't going to own these properties. These are going to
Nope.
be privately owned properties that are in disrepair or blighted. And so is
They
your,
could be owned by a municipality.
could be, but if they're not, if
Yeah.
they're aware of properties in their township that it's like, oh, you know, the Smiths have owned this forever, they just can't get it to where it needs to be. Do you want the townships to contact the property owner to find out if they're interested? What does this process look like?
All they have to do is present that project to me.
But you want them
I'll
to
make the
find
phone
out,
calls,
okay,
I'll-
you'll do it.
Yeah, if you
Okay.
have some projects that you think might be viable for this funding, present them to me. I'll make the phone calls, I'll talk to the people, I'll explain the process. And they can decide whether they're interested or not.
Thank you.
Yeah.
What I'd like to do is I sit on the housing committee in Traverse City, and we talk a lot about Benzie. And maybe I could sometime get you, and if nothing else by phone, have a conversation with them about these
Absolutely.
areas.
Hmm.
Can I shift gears just for a second?
Sure.
So we got our Moody rating in for the
Yes.
benefit of the public. Do you want to talk about
Yes.
that?
Hard to talk about. It's
So
hard
it's
to
good
read,
rating.
actually. Yeah, I just wanted to share that rating with you. I think we're in good shape financially, long-term, robust planning, all those kinds of things play into that number. And, they approached me a couple weeks ago with a draft that look it over if you have any errors or things that we've omitted, please let us know, but otherwise we're going to publish that on their website. So that is on their website now, so now it's public information. Before it was
Oh.
not available for me to share, but now it's out on the website. I just wanted you to know that's what's on Moody's website.
For the benefit of the public, we got a AA rating, which is the second highest rating you can get.
That's up from the AA minus that we got in 2013 when we went out for a bond. And that was a half a step up from where we were all the years before when I've been here. But in 2013, we bonded for the Maples project. And at that point, the financial sources all do a deep dive into our finances to rate us before we purchase the bonds. And so it's kind of like individually, it's your credit rating before you go to the mortgage company. That's what that is. And so now Moody's just does it on a cyclical basis, but I'm not sure what that cycle is. They don't do it annually. This is the first time I've had it come to me without requesting it. And we had to request it before we bonded in 20.
Thank you.
Thank you.
So I said I attended the housing conference. There were 220 folks registered. The room was full and there were a lot of community members that you would assume would be there. There are many community members you would not assume would be there. And so a lot of people are interested in housing and a lot of people are concerned about their communities. I sat with a lady from Charlevoix County. She's just a taxpayer, but she's wondering what she can do. Wondering where her strengths would best be suited. And so she came with 2.5-day camp. So I was amazed by that. But anyway, everybody's interested in that. And also I sent you a copy of the Benzie County numbers for housing that were published by Housing North. Takes a bit to read, but it's interesting. Some of the things that we're good at and some of the things that we are not good at. So interested in housing, that's a pretty good report and it's pretty recently put together. So, and then I gave you the link to the 600-page regional one as well.
Thanks, Michelle. So we're going to move on to elected officials, department heads, and I'm going to slide Miss Christy Johnson in from Munson Healthcare. No, not here yet.
Not here yet.
Okay. So to item A, pardon me. So, I'm sorry. As well, Carly's here from the courts, so.
Morning.
Morning.
I'm here today because I am looking for a signature on a Ottawa County Juvenile Detention Center bed rental agreement. So every 3 years, they send us an agreement. This is just stating that they still want to work with Benzie County, and in the event that we are seeking placement, we are able to call them, see if there's a bed available, and if there is, and that our kid suits the needs that they also have, then we're able to place them there. So
Is there a cost?
there is a cost, $290 a day for detention. And then for the treatment program, it has gone up to, I believe it is $370 a day. So kind of like the trend that we saw last year, detention centers are going up in cost as well. So
Is there a cost for us to be on board?
no,
Okay,
Nope. no cost whatsoever unless we are placing a kid there.
okay,
And Chair, may I ask a question?
absolutely.
Carly, if they are ever reject it, what happens? Do you ever reject kids that they can't come to the center?
So if they are full, then they
Oh.
are full and we have to look elsewhere. What we saw with the raise in age is that 17-year-olds kind of are taking up most of the beds in detention centers throughout the state. And a lot of the counties will become county-only residents for their detention centers.
Okay.
So that's really where we find ourselves in quite a jam when we are looking for placement for a youth. In Benzie, we haven't ran into this problem, but in Manistee, we did have to place a youth in Ohio. And that was about close to $500 a day. So 290 is wonderful in the state of Michigan today. So that is just the trend that we are seeing with detention centers throughout the state.
I'd like to back up to Commissioner Roloff's question. He asked if there's a cost to us.
There's a cost if we have a kid placed there. There's no cost in just signing the rental agreement.
Okay,
And that's what my, was there a cost just to get on board to say we're part of it?
thank you.
So this agreement's essentially saying it's creating that partnership between the two of us. So then if we're in need and they have a spot for us, we can easily take that spot. This is creating that relationship. We've utilized Ottawa County for some years now. So this is just a renewal for the most part of that agreement, other than costs are going up.
Just wanted to make sure I understood the memo right. That's right.
Yes, no, I was afraid that it would look like we are renting a bed for the year and we are not. So I would love
Okay.
to, but we aren't. So
So Ottawa's a fairly decent sized county. Can you tell me exactly, not exactly, but what town? Is this Zealand or is this over by the lake or?
it is, I believe in the Grand Haven area.
Okay.
Yes, yep. As you're kind of going by all the blueberry fields, run into Ottawa Detention Center. And we have a wonderful partnership with them. We go down there and visit our kids that are placed there. I'm in good communication with the director there. So they have come to our aid when we've really needed them. So I really love to continue that partnership.
Very good.
Just for a frame of reference, did we place kids there in 2023?
We did,
How
yes.
many?
We had 2 kids placed there. We have called them to get put on a wait list, and right now they are only taking their own county residents.
They're an average length of stay?
30 days. Yes, unless they're in the treatment program, then that is between 30 and 90.
Gary?
Yeah. So the agreement just allows us the possibility of a bed. We don't have any guarantees. And that's a concern to me because that's why you end up in Ohio and stuff. So I know there's very few places that we can work with. The agreement is basically, is there's a chance.
Yes.
Okay.
And unfortunately,
Can't say I'm
that's
real happy
kind of
about
the trend of
I
it.
know either.
Yeah.
And that's really why last year especially, I mean, I was a probation officer for 6 years, so I had relationship with these detention centers, but as the director, I wanted to make sure to go to as many in person, shake hands with the director. We went down to Monroe County, took them a wonderful gift basket from the Cherry Hut. Showed them a little bit of Northern Michigan, and it's those interpersonal relationships that truly have come to our aid. And as you know, sad as that really is, I'm okay with making those personal relationships too, if it's going to benefit our kids in our county.
Thank you.
Good. Thank you. Much appreciated. Anybody else? All right.
Do we need to do that now?
We
Is
need a
that the first
motion.
one?
Yeah.
And I suppose you wrote one out somewhere?
I did.
I'll move to support it and you can second anyone.
All I
That
gotta
the
do is
board of-
find it.
That the board approves the agreement with Ottawa County Juvenile Detention Center as presented and authorizes the chair to sign.
That's what I
There
said.
you
Thank
go.
you.
So I have Gary making the motion and
I'll
Karen
second.
supporting it.
I found it.
So there is a motion and support. Is there any further discussion? Roll call, please.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Worzak,
Yes.
Cunningham,
Yes.
Janat,
Yes,
motion carried.
Thank you very much. Yeah.
You.
Move on to item B, consider accepting proposal for IT co-management services in consideration of the creation of an in-hours IT coordinator position. Matt and Kurt?
So I've invited Matt and Kurt here today. They're with Karu Cyber, which is the agency that I'm recommending we work with for IT services. Both Commissioner Sauer and Commissioner Cunningham have met them a few times at conferences as well. As you all know, we have had a great deal of trouble with our current vendor. You've gotten emails from staff regarding that, and you've heard the rumbles in the hallways. We've been working with that agency to try to improve the service. I meet with our account manager, the help desk manager. I've met with their, higher level executives to really tell them things aren't working and things really haven't improved. And so we were able to obtain 3 proposals from 3 companies, one from our current service provider, to, maybe pivot and move forward. Their proposal is in your packet, was most favorable. And in our conversations with their group at the MAT conference and such, it's been very, very positive. So I've invited them here to go through their proposal and answer any questions that you may have. They do have a PowerPoint that we could quickly go through as well. But we'll start from there. Their proposal is for a co-managed service. A co-managed service would be that they would have somebody on site that they're really working with as a point person for Benzie County. I say on site, that doesn't mean it has to be a rostered position. It could be a additional contracted position as well. Most agencies are going similar to that format. Manistee, for instance, many of you have had dealings with Manistee for years. They have Gordon. Everybody knows Gordon. Gordon contracted for over 20 years before they hired him in as a rostered position with Benzie County. He is their IT person who works with a third-party service provider. And that is the model that we're hoping to go to here in Benzie County. We've talked about this at our various staff meetings, and I would say as a whole, I can confidently say that all the department heads and elected officials want somebody on site, whether it's in a rostered position or a contracted position. That is definitely where the staff wants to be. It's a need. We need that daily interaction. My office a lot of times takes the brunt of that for down here. And then also Rebecca Hubers and Corey Ellis a lot of times fill in for up the hill and down here as well for that day-to-day stuff. And we have other things that we need to be doing. And so that's where we're at with it. So I will open up the quick PowerPoint unless there's any questions before we get started with their PowerPoint.
The only comment I'll make, Katie, is I wish Commissioner Markey was here because he's the most knowledgeable
On IT, I know. So it's just a scroll.
Please, first, thank you for allowing us to come here and speak today. I actually founded the company around public service. I'm coming out of the DoD. I was in the Navy for years and wanted to continue that public service. We've been with Houghton County since roughly November of 2021. We're continuing to try to grow into the county spaces with County of Michigan. We have 2 prior IT directors on staff, so we have extensive experience with county IT as well as that background. I've also been cherry picking people out of my team that I led in the Navy, doing defensive cyber and bringing them on board as they get out of the Navy. So we have a really, really strong backing in security as well as IT. Great confidence when I say Benzie County, we're a small enough company where every one of you will have access to whoever on my team you want to have access to, especially me. I'll be the main project manager along with Matt here on the team. So with that, no questions. I'll just kind of, I'm gonna try to go. This will probably a 20 to 30 minute PowerPoint. So please just interrupt with questions. I'll just kind of skim over it that way. Not going too far into the weeds.
Before you get going, can you tell me what your names are, your full names?
Yes, Curtis Penola
Okay.
and
Westbrook.
I have their spelling,
Okay.
Tammy. I can get to you.
Thank you.
There's an apostrophe in his last name. It
Okay.
makes it hard.
last name.
Okay,
Yeah.
thank you.
Then to start at the top, I guess, Karhu means bear in Finnish. I'm Finnish. Mama bears are specialized. That's a little bit about us. So So this is between like a 500 and 1,000. So I know you guys get like quantified metrics a lot from your different departments, from accounting, HR, different departments throughout the county. They're always giving you numbers, and I'm highly doubting that you're going to see these numbers from a risk posture and from an IT perspective. So that's kind of why this slide's here, is to show you some of those numbers. The chart on the left, that's from Risk Lens. I'd be happy to forward this out to see the quantify some of the might face. On the right side, that's from the Verizon DBIR. It's a well-recognized report that Verizon publishes every year. Your more pages, pretty expensive, but this is the particular one that talking about public administration, and you can see some of the potential threat actors and their objectives, why they do it, and what the associated costs are, data loss for your. Any questions on this one? This is basically a graph of this one right here, top left one. So this is just to illustrate some of the potential consequences of not shoring up security. So with us, we're coming on to help with IT, but our main focus really is to make sure that the constituents' data is staying safe. Someone's able to compromise the network and take, let's just say, birth certificate, wedding records, court files. Maybe you have a murder one on trial, and then someone compromises the network and publishes all 14 jurors' information. Like those are intangible secondary costs. These are not, right? These are real bottom line dollar costs of cyber attack. Again, I can share the actual reports. So at Carhu Cyber, we kind of focus on cybersecurity from a defense in depth perspective. So we have a virtual CISO that's to provide that strategy and guidance. So I'd be meeting with Mrs. Eitz and an internal point of contact that established to kind of come up with that plan for, on a 30, 60, 90, 180 day type of perspective. And we'll publish a report on a quarterly basis, I think is what we agreed to. But that report will say, here's the security posture of the environment. Here are the overarching projects we're working on. Here's what we said we were going to do last time. Here's what we got accomplished. And here's what we're going to do in the next 30, next 60 minutes. Threat detection and response, that's that 24/7, 365 monitoring. So we have a security operations center with actual that leverage AI and ML to threat hunt environments. I specify actual people because a lot of enterprises and are using AI back software to monitoring. Use that, but we also use top of that. A lot of things that AI and ML aren't able to detect yet. And cybersecurity is a lot about rules, and if a vendor releases rules for things, if that catches it or not, right? You don't want to just rely on that one single solution. Vulnerability management, basically, we can kind of look at the county here as a castle or a home, right? So a home, you lock the windows, you lock the doors, you have a dog. Alert you of any here, you might have a gun in the bedroom or in a safe. But you're able to protect your home through a defense in depth posture. Vulnerability management is to identify all those ways in that house. Hide those vulnerabilities with compliance management. That is, you guys are held to CJIS and FOC. So a lot of counties in Michigan are looking at this from like a reaction position. So that you have an audit. Everybody's panicking, running around and not really having a strategy beforehand. So you got to implement controls. You're spending a bunch of money last minute. This is just have a strategy. Well, up front, be looking at those compliance requirements and make sure. Security engineering is kind of the delivering of a lot of these services. It's kind of the back end, the catch-all service to make sure we're implementing the proper controls or identifying gaps, things like that, performing the security assessment. Training, that's another gap commonly see here in Michigan. So I'm on site to perform that training or do it remotely. I personally prefer in person. I think it has more impact. So small group formats, 10 posts that way back. Everybody up this stuff that's happening in cybersecurity and why they matter, because over 80% of data breaches come from an insider attack, and that's got to change. IT on demand. So the current proposal to we're gonna cover the IT county and also help with the interviewing and the process for hiring an IT director. We did this exact process with Houghton County. You guys have any people over there you'd like to reach out to and speak? Virtual CISO, again, we kind of covered that in the initial slide, but other things we're looking at. Operations as a whole, risk management, our client attestation reporting, business enablement. This one's a key one, is making sure that we're prioritizing the available resources, aligning with the budget, aligning with the security, and this really factors risk as well, as we want to make sure we're balancing the risk of the county. Just have easier options, right? Accept it, avoid it, mitigate it, reduce, control it. That's all performed between business enablement and risk management. As well as productivity, right? We could turn this place into Fort Knox and make it really hard to use the systems, but they'd be really secure. Or aligned with. Kind of covered this one, risk management. Kind of how we build a security program as a whole, right? We want to identify the problems, the gaps. We're going to implement solutions to mitigate those risks and those gaps. We're going to manage the program. So that's more towards preparing for audits, more continuously updating. Cybersecurity landscape is constantly changing. So that management. Kind of like a sneak peek of what our users, our security analysts are seeing from the Security Operations Center. Leveraging, you can probably guess these are backed by AI and ML to graphs, and the users are coming in to identify different anomalies within here, and then comparing that against other stuff we've seen and backed by threat intelligence. So we're pulling in different feeds from everywhere. This also supports our incident response. We also see in the proposal, we have an incident response retainer. That is to allow us to basically get boots on the ground as soon as possible in the event of an incident, rather than having to call, Katie or get the board on the line somehow and say, hey, you guys are experiencing a cyber attack. We need to get to work immediately. It's going to cost a little extra because we're sending people out. We're doing this and that. So we include an instant response retainer. Time is very important. It's kind of a snapshot. It's actually from one of our monthly security reports. This is a screen grab from it, just illustrating kind of the vulnerability management part of the process. Is we're going to identify critical, high, medium, and low vulnerabilities, and then monitor them over time as we implement the remediations and patient of those vulnerabilities down. This falls under the compliance portion. So CGIS, that's your FOC controls. FOC falls under CGIS, and the NIST 800-171 is CGIS requirement. So we monitor these, and this is going to come up in the monthly or quarterly report. So you'll be able to see, hey, where are we at with compliance? You now know, instead of wondering if we're ready for the next audit, you'll have document. This slide's for security engineering, but there's a lot of overlap with IT on demand. So it just kind of meant to illustrate some of our planning efforts. We're really looking at this from, a years long perspective, so we can implement our different objectives and really get that defense in depth posture stood up, make sure we're responding to needs, point needs, network needs. There's a lot that goes into this. This is just kind of an illustration of that. This slide is meant to address training. Just some of the topics that we have available to train on. Phishing awareness is performed through a platform where we're actually going to send phishing emails to the end users of the to test their readiness for phishing, because as I stated earlier, 8% of data breaches are coming from that insider. So it's important. But all the rest of these things are playing into that defense in depth. Got to look at cybersecurity from a macro perspective and then zoom into the micro on each different level. This is just a quick rundown of the IT on demand. So we'll have a remote monitoring and management solution in place where we'll be able to access the desktops. I'm really going to be pushing for an internal point of contact for IT, because there needs to be someone there to unclog the printer, talk to users and be that point of contact internally. It's definitely an effective strategy that we've seen across enterprises as well as county governments. But we do have a pretty robust capability set for remote, and we can support on-site on an as. This is just kind of a catch-all slide to just talk about some of the other things. So like with us, we're not looking at selling you something you don't need. So we like to just make sure to highlight, there's a lot of things that go into this. And we're basically going to be providing these over a period of time to include grant funding support. If you have a copy of the proposal, you should see that we just recently heard back on Houghton County's grants. They were approved. We have a relationship with Daniel Bordeaux over at the MMRMA. And all of their grants were approved for 50% funding for vulnerability assessments, training, and MFA. So MFA is actually a CGIS and FOC requirement by March, so we got to get moving on that one. Rest of the next window, I think, is January 1st or January 10th. Yeah. So we talked about vulnerability assessments, penetration testing, that's a service where we're looking at it from like a more of an adversarial perspective and trying to identify what vulnerabilities can be exploited. So it's kind of a continuation of the vulnerability assessment, if you will.
On that subject, if I could.
Absolutely.
I understand a lot of risk managers are going to this dual authentication. Is that what you would be recommending?
Absolutely. And it's backed by the MMRMA and it's a requirement. Absolutely. MFA. And we have a partnership with RSA ID. The reason we got that partnership is because that's what I use in our group agency. So the whole time I was in the Navy, I was actually for the NSA. I never went on a boat or any of that. So we use what's called RSA tokens. They're just like little physical tokens, or you can have it on your cell phone. And it generates that algorithmically randomized number every 30 to 60 seconds. And you use that to authenticate. It helps with password management. You don't have to memorize passwords, etc. So absolutely be recommending that.
We've been in the hopper with our current service provider for a year now. I have all the hardware. They don't have the staff or the time to implement it for us. And I've continuously asked their timeline and have been continuously told, well, in a few months. Well, in a few months. So unless they get moving, we are going to be out of compliance. And I have all the hardware.
Yeah, we also perform like an IT and security assessment annually and understand the deltas, right? We want to look at where we were, where we are. And that assessment's really kind of going to drive that. Backup and recovery, that's hugely important in the event of an incident. So we'll evaluate your backup recovery strategy. If you guys don't have any sort of quarterly governance committee, I would, once we kind of get rolling, I'd like to establish that. That way we're all on the same page as far as posture, where we're at with security control, IT. And just the whole thing, go through the full gambit, talk extensively about what risks you want to accept, mitigate, all things. And third-party vendors, like this one's more just to illustrate how this is defense in depth, looking at our vendors themselves, right? This company's selling us servers, right? Well, where are they getting them? Are they getting them directly from China? So firmware is pretty easy to administrative controls. So if at Benzie we don't have in place the policies and procedures for remote users, policy for passwords, things like that. We have that all pretty much templated. Just swap the names out, run it by you guys, get those approved, and then those kind of need updated. That's kind of the 30,000-foot view. Any questions?
Well, I have a comment. I'm familiar with what you're showing us on screen, and I recognize that it's a lot of the outline and everything is from a government approach and our training that we have in the services. So I commend you, and I have full confidence on that information that you're giving. My question is, because you were talking about personnel, and then Ms. Zeitz also mentioned that, would you have the personnel, I'm not quite sure when this would be in effect, but would you have someone available that could be here in person for us if needed?
That's something we'll definitely be addressing in the first 90 is trying to figure out
Okay,
the best
first
way to do
90.
that. Whether that means we have to get somebody on site. We don't be abundantly clear, we do not want to provide for you. That, if that comes out though in the first 90 in these discussions, like, oh, well, we can't find anyone, then we have to hire somebody that we can vet on our own and put them in
Correct.
under as a contractor, we can look at that. But my current perspective is we are a security first company. We're here to support your IT part of security.
And that was going to be my second question, how you're dividing the security and the IT, but you've answered that
Yeah.
right now, so I understand that.
It's not very well divided.
No, okay, all right, because they're hand in glove and they have to support, so I get that. The other thing I noticed is one of the other companies, I forget the
BC3.
yes, had a little graph in their charts that showed how they prioritize what's an A priority to a B priority. Do you have something like that and resolution rate on that?
Yeah. Are you saying from a ticket perspective, like an end user perspective, or from like a?
Discovery first, maybe
Yes, that would be-
avoiding.
That
Mhm.
we performed that initial assessment. So step one of every contract. we do is
Okay.
an initial security assessment, the IT assessment. Results. Perhaps, go through what the gaps. I'll give you my
Okay, so it
recommendations,
will,
Problems to me. I'll care about that problem. And we basically work through that to identify what's the priority. As far as like end users, we have a ticketing system that we integrate where they populate tickets and they prioritize it themselves, and then we fund a.
all right, perfect, thank you.
Katie, what's our contractual obligation with BC3 as far as terminating our agreement with them?
So our actual agreement is with IT Right. So Benzie County entered into a contract with IT Right some years ago. IT Right was taken over by this VC3, which is a national company. And so we operate out of the IT Right contract. We don't actually have a contract with VC3. That's what you see in the packet, is to actually redo that contract with VC3. So as far as like getting out of it, we can get out of it with no cost. So the contract currently is a calendar year, but we've paid through December 31st of 2023, and we haven't paid anything for 2024. So we can get out of it because we've already paid through the end of the year. And technically we're with IT Right, so we're under those IT Right terms. And that's one of the things I spoke at lengths with VC3, is that was my understanding. When VC3 acquired IT Right, we were under these IT Right terms. And I said, but we're not. They're not being held to those same standards as IT Right. IT Right did a lot more for us on the ground. VC3 hasn't had somebody in our building in months until last week. They also, IT Right didn't charge us for installations, and things like that. They charge us every hour of every single service call that they provide to us. And so now we've exceeded that contractual amount with VC3/IT Right. So your question is how can we get out of it? Absolutely.
Anybody else?
So, staff is recommending Karu Cyber. Is that how you say it? Karu?
Finish way would be. Car.
Okay, I can.
I say car who?
Karhu Cyber. That would be our recommendation, but part of that recommendation is we would have to move forward with acquiring either a contracted or rostered position to be that point of contact with Karu. Karu, whatever. My office can't continue to do that. We can, on a high level, we help IT needs. So does Rebecca. So does, others that are capable, but we can't continue to do that. So that would be our wish. And they have offered to essentially sit down with us and go through that process and establishing that job description and those needs that we need out of that person. And, sit down and interviewing and, kind of be the lead in that, because none of us on staff are experts in IT. And so they would be our expert through that process as far as identifying someone who would be capable of doing the work here on site.
I just want to be clear too, that it's the county's policy
to do RFPs and look at an array of companies, and you've done that legwork in the background, correct? That's why
Yes.
there's one company coming before us today.
Yeah, so there's three proposals in your packet, and I reached out to countless others. Just saying, hey, can you look at us? Can you give us a number? Can you do these things? And so I was able to obtain these three. Obviously that we're not hitting everybody because we can't, but yes, so we've reached out to multiple agencies, yes.
And as somebody who's not super tech savvy, I'm assuming that you've looked at the services we've been provided by VC3 and
Yep.
give me the high level. The biggest differences your service is going to provide, should we choose to go with you, are going to be what?
Security.
Security. Okay.
Yeah,
Service. That was one of the biggest things. Biggest complaint. Katie was our main point of contact and biggest customer. Because we're a small company, we're customer service.
And he's a Uper.
the biggest thing you'll see is customer service, but biggest thing is we need to get the county secure.
Security.
Yeah, so we recently, we're actually still in the corrective plan for court security audit. So there's an FOC audit that Kurt was talking about, and the state calls that onto FOC offices every so many years. And so we did that audit last year, and we're still closing in on all of the things they told us we needed to implement, because the audit, I don't want to say it wasn't secure, but it was far from meeting the standards of what the state requires. And so, I'm hoping the next audit in 3 years, we don't have a laundry list of things we have to implement to meet their standards. I'm hoping it's none or one. And that's, the VC3, when we went to them with that court security audit, they were like, what's that? And that's because most of their staff has been great, and IT Right was wonderful because they were a Michigan-based company. When they merged with VC3 and became a national company, they lost most of their Michigan staff. And so we've had a few folks that are still on site, Eli Barnes specifically, who's been just a wonderful, we love Eli. We even got his cell phone number, and I think sometimes we abuse it, but he's a great guy. But everyone else you speak to is in Texas, California, Oregon, Florida, and they have no clue of what's going on in Michigan, which is a problem. And the biggest problem from the staff is the response. I think one person waited on something almost 2 weeks, and that was with multiple follow-up.
For the benefit of the room, I think when you mentioned the issue with having the equipment in VC3 hooking it up, I think I heard you say that should have been done in a day or two. Is that correct?
Yeah, if you already have the tokens, that should.
We've had the
for MFA implementation.
yeah.
Pretty quick turnaround.
We've had the
Hook it up
tokens
to
and the
software.
hardware for a long time, like since January or February in our office. We just keep shifting the box out of the way.
Katie, I'll be the first to admit that I'm not really qualified to make this decision, although Karen, I appreciate your comments on that. But what I'd like to do is just focus for a moment about this coordinator that you want to add to our roster. Where's the funding going to come from on that?
So the general fund contingency. So as you know, we've put about $500,000 into contingency the last 2 years. I foresee some of that funding coming from there. We did beef up the technology budget this year by about $30,000 in anticipation of looking at other companies and those sorts of things. So I already did beef up that technology fund by about $30,000. But I foresee it coming from contingency, which of course adds some concern for those really going after this community coordinator position, which I do believe is also a need in Benzie County. But a need and a priority sometimes are just a little different. I don't foresee us putting the community coordinator position to bed fully, but I see it, slowing down and moving forward with IT sooner. And we are really there. That community coordinator position, we're very much in the infant stage of that. Parks and Rec and EDC still have some more legwork to do before it comes to the Board of Commissioners. And so there's a lot of time before we even get to that point of potentially hiring that position. So we could still do both. is what I'm trying to say. But that priority is the IT first, focusing there a bit more strong than moving forward with that community coordinator immediately. We can still continue to work on that legwork and get to that perfect picture of hiring a community coordinator. But I'm wanting to pump the brakes on that a little bit because IT really is the priority right now. And then we'll continue to move forward with that other position. We may still be able to do both, depending on the timing and where things shake out.
But just to follow up on that, your staff will tell you firsthand that they've had to have my experience of needing some help.
Yes.
Which I appreciate, by the way. They were very responsive. By the way, so is your current provider. Maybe I was just getting preferential treatment.
You probably were.
But sitting on the EDC, I can tell you that I felt like we're probably mid next year before we're really doing anything. But someone that's been working on this EDC position for nearly 20 years.
Yes.
I felt so encouraged that we had finally crossed the goal line on that. And now I feel like, I've been penalized and I'm back 10 yards.
I would say we're at the goal, but we haven't crossed the goal line yet. I think we're still there. There's some more legwork to be done. We need a better kicker, I guess. I don't want to say we're throwing that out with the bathwater. Not at all. I do see the benefit of that community coordinator position for Benzie County and what it could bring to the table. What I'm saying is priority is IT, and that comes next. So I think we still continue on that legwork. It was suggested that we have a joint meeting with Parks and Rec and EDC, which I think we try to schedule here over the next couple of months. With holiday, that may slow things down. We still continue to pursue that, but I think priority is IT that we need to jump on now and then continue to work on that community coordinator position. I'm not saying no to it. I'm just saying let's, really put the thought process into that first.
I know that Tim had mentioned to me, because I talked to him before the meeting, he actually thought you needed up to 3 people.
I know he did.
And I'm thinking Jackie's doing a heck of a job. We could just continue with that.
Oh, no, she doesn't want it.
Undersheriff, did you have a comment or something? Absolutely.
Houghton.
Overall last. Cover the lien. This lien, you have some. Yes. Familiar with the lien requirement. Oh, yeah. I wanted to. And what we were kind of discussing a moment ago.
Thank you.
I did have one other note on that, the cost side. I think we came in under your current projected spend with VC3, so that should free up a little bit. I know budget management's not my problem. Just wanted to throw that 2 cents out there. Then also we could look at hiring somebody that might be potentially less skilled in the IT domain, and we could kind of teach him to fish, to help him grow. Or
So that is too. So we currently, our base contract is 63.6. And then, of course, we pay outside of that for all the service calls and the equipment and those sorts of things, which we're still going to have to pay for equipment. They're proposing a total cost of 76,000, but are pretty assured that they can receive grants in the amount of 19,000, which would bring down the cost to 62,000. And like I said, I had already beefed up that budget by about $30,000, just projecting and looking at this whole process. So some of that money is already set aside, which helps the community coordinator venture as well, because we're not hugging so much away because we've already planned for some increases.
And are we going to hear from the other 2 companies too?
Nope. I invited them only because as staff, this is what we felt was the best direction to go.
With that, let's see how it lands, I guess. The Board of Commissioners accepts the proposal from, and I'm not even gonna do Cyber for IT services in the annual amount of $76,100 for a period of 1 year with funds available in the general fund technology department and by grant funds, and further that the proposal for interim IT services be accepted in the not to exceed amount of $6,000 a month for a period of 3 months with funds available in the general fund technology department, and that the related budget adjustments from contingency be approved.
And I would support that.
There's a motion and support. Is there further discussion?
Just to be clear, as we venture into this, this is going to be a contracted position. We are not discussing putting this person on the roster at this time.
So the first motion, which Gary just read, is only taking care of the IT part of it. And then you'll notice in the packet, I have 2 additional motions as options for you folks to take action to either create a rostered position or to create a contracted position. So the motion that Gary just read is specifically for their services. Yes. So there's a laundry list of motions for you to consider in the packet.
Any other discussion?
One thing that always sticks out to me, and I think it was kind of said the other day at the veterans, these folks are all veterans, and that's huge with me, considering that only 7%
Yep.
this country population steps up and does that. So extremely proud to even work with these folks. So
You beat me to it.
okay.
And like, just to reiterate, the schooling that I know you've all gone through, having been either trained in the military or been in the military, all of you. So you have those clearances too,
Yes. Top secret.
top secret clearance. Yes, I understand that. So for that, for us, that training and the current, I mean, there are some things our government does very well, and training our military is one of them.
Yep. Any further discussion? Roll call, please.
Nye,
Yes.
Roloffs,
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
you're not,
Yes.
motion carried.
Thank you, gentlemen.
So the second part of this is talking about that position. Either way, we're gonna work with Karu, and they're gonna help us facilitate the process wherever it lands as far as rostered, contracted, or what have you. But the second part of this is for you as a board to decide how you want to proceed. Do you want to proceed with a contracted position, or do you want to proceed with an actual staff person for Benzie County?
Just a comment on that. I'd be more comfortable on a contract position right now, and let's see how it goes from there. So I'd be willing to make the motion that the Board of Commissioners authorizes admin to seek a contracted information technology coordinator position with contract to come back before the Board of Commissioners for approval.
9 seconds.
Motion and support. Is there further discussion? Roll call, please.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
you're not,
Yes.
Nye,
Yes.
motion carried.
I will work with them to start coming up with what we're going to seek out in the real world as far as a contracted position. We'll kind of go through that process of the RFP or RFQ, I guess, finding that position. And I'll ask a few staff that we have that I know also is pretty key in our IT services now that we're doing here, boots on the ground. We'll put together a staff committee and bring those proposals forward to you so that we can decide on a final person to come on board as a contracted employee. So stay tuned.
Okay, ready?
Thanks.
Move on. Ms. Johnson, would you please?
Be with me today,
Perfect.
and I'm actually gonna let her start if that's okay.
So if you would both introduce yourself for the clerk.
Go ahead.
Well, good morning. Kelly Tomaszewski, President of Paul Oliver and Manistee Hospital.
And Christy Johnson, the Chief Operating Officer, Chief Nurse Officer for Paul Oliver Hospital.
Thank you.
I'm going to pull this.
If you would,
PowerPoint right
I
up?
do have.
Okay. Perfect.
Awesome.
Well, good morning. Want to thank you for having us today. We're really excited to share what's happening in Munson Healthcare and specifically what's happening at Paul Oliver Memorial Hospital right here in Benzie County. You may have heard that Munson Healthcare is looking at a transformational plan throughout the entire healthcare system. We've been through a lot in the last few years. Healthcare is in a very different place than it has been even in the last 20 years. We don't talk about the pandemic every day anymore, but that is part of the reason why, as a healthcare system, we realize that we really need to look at the healthcare that we provide for all of Northern Michigan and what we do at each location. And some areas will have some change and some will not. So we just thought it'd be helpful to really kind of do an overview of what that transformational care plan is for Munson Healthcare, and then really break it down to that local level. So we really have an understanding of what that means for all of us here in Benzie County. And we're going to get into the graphics of it in just a little bit. But when we looked at the healthcare that we provide to our community, which is really the why of why we get up every day and come to work, we want to take care of our community and each other. We really recognized there were like 4 or 5 different buckets of work. And we recognized the number one thing that we needed to do in healthcare is really adapt to be more patient-centric. And we already are patient-centric. But when we looked at our healthcare delivery teams throughout Northern Michigan and really throughout the country, big systems are doing this as well. We recognize that it's really important that we continue to provide access to care that's easy for patients to get in to see a provider. And not make the emergency room someplace where people go to get that care immediately. And so that primary care we talk about, the patient, the doctor or the nurse practitioner or the PA that you go and see every year for your annual visits, they renew your prescriptions, they make sure that they know you, they know the health of you and your family. Having somebody and access to that is a challenge in a lot of rural health areas, which Paul Oliver is in a rural health area. We're a rural health hospital. And so we recognize that we really have to increase the access of that care, because it's going to sound kind of counterintuitive, but our job as a healthcare system is to keep you out of the hospital. It really is to keep you healthy and vibrant and active, so you can contribute to your family, your work life, and your community. So access for number one, and then navigating through our healthcare systems can be really tricky. If you're not in healthcare, it can be tricky. If you are in healthcare, we want to make sure that it's seamless. You see your primary care provider, and if you need x-ray services, that we have an easy way to do that for you, and et cetera. So just really coordinating all that care so you as a customer of healthcare are going to get the very best care that you deserve. We also recognize through the pandemic, a couple of things came up. We recognize we need more home health, because not everybody can get to the hospital or get to their primary care. We want to keep an eye on you so we can prevent issues from escalating. But we also recognize there's an opportunity for virtual health care on the screen. You can do that on your phones now. And Chrissy's going to get into more detail about that in a little bit. But recognizing just those are 2 really great resources that we, especially virtual care, we really hadn't utilized that as much as we could have. And some things came good from the pandemic. And that is one of the things that we recognize. It really escalated our opportunity to provide virtual care for folks so they can really get that visit on their phone at home. We know broadband is a challenge up here in rural areas. And so just having that ability to use your phone is really helpful. We want to make sure that inpatient services, so if you do have to be in the hospital, we want to make sure that we have the proper amount of beds and availability for that. We do have that ability at Paul Oliver. It's a small inpatient unit, but if you need to stay overnight or for a few days, we have the opportunity to do that. And then really looking at the care that's provided at each of our entities and recognizing that we really need Munson Medical Center to continue to be our tertiary care center. So if you go to the ER at Paul Oliver and you really need to have a higher level of care to be admitted somewhere, you're really sick. Maybe you've had a heart issue or a lung issue or a stroke or other issues. We want to make sure that we have the ability to get you to the medical center in Traverse City versus having to send you to Grand Rapids, Detroit, Ann Arbor, et cetera. And we have that ability now, but we really wanted to kind of with that plan of transformation, make sure that Traverse City is going to be the tertiary care center so we can really continue to give that care closer to home. If you have any questions along the way, just shout out. So when you look at this next slide, and it's the big H side. When you think about healthcare delivery, a lot of times we do think about the hospital proper. And, there's so many other services that we provide. But when you think about the hospital, if you look on the left-hand side, it says that's our South region. And by that, we mean it's Cadillac, Manistee, and Paul Oliver. So the south part of the care that we provide. Paul Oliver is kind of getting into the north area, but we're still considered the south. And then if you look on the right-hand side of that, Charlevoix, Otsego, and Grayling is considered our east region. And then Grand Traverse, right up in this area is called our central area. So this right here is Paul Oliver, and you can see we're right there, but this is our south region. And so when we think about south region care, when we think about those patients that need to get a different level of care and they maybe can't stay at Paul Oliver, we can also look at Cadillac or Manistee. So not everybody is going to Traverse City because we need to keep that availability for our sicker patients to go up that direction as well. So future state. So if you look at this, we see hospitals, and that's how we think of ourselves. So we have to think outside of that, and we're not just the big H anymore. We still are an H, we still are in hospital, but we also have to think about all the other services that we provide in our communities so you can get care at different places. So it's almost like a different front door. We say that because we used to think that you'd walk into the hospital and that's where you'd get most of your care. But we know that in healthcare, we've really evolved and that's not the case. So if you look at Paul Oliver, just right here in this area, we have primary care, which means that, again, it's that access to care. We even have Frankfurt Medical Group where we have providers right in the hospital, which is really unique. And not every hospital has that. I would say we're probably one of the few in the system that do. But you have that care right there. And then isn't it great if you need to get lab or radiology services, you're right in the hospital and you can get that care in a really timely fashion without having to travel. A couple other things that are really unique for us. We have specialty care. Which Chrissy's going to talk about in a little bit, but we have Frankfurt Specialty Clinics, which are right downtown in Frankfurt, where we have visiting specialists that will come on site for wound and heart and kidney and GYN and orthopedics. So we have a lot of visiting specialists that will come right up to Frankfurt. You don't have to travel to a different city. You can really just get that care right in town. And really that's again about bringing that access closer to home so you don't have to travel. And a couple of things that are unique too, we have dialysis unit, which is very unique in here in Frankfurt. And we also have long-term care that is associated with the hospital. So we offer a lot of services in Frankfurt that is really unique to us. And it really does make us feel proud that we can provide these services to our community. Things that we also offer in our hospital setting, I already mentioned Frankfurt Medical Group for that primary care access. We have lab radiology, we have therapies that are stellar. We have PT, OT, and speech therapy, cardiac rehab, 24/7 ED, dialysis infusion that I mentioned. So we don't do chemotherapy infusions at Paul Oliver, but we do injections, we give blood, we give hydration if you need to have some IV fluids. And there are folks that are our patients that are cancer patients that go up to Cowell or they go other places for their care, but we can provide that supportive therapy right here in Frankfurt. And if you're going through cancer treatment, you probably aren't feeling the best. So we want to make sure we can give you as much of that supportive care right here in Frankfurt as possible. And unfortunately, I always say that area is always growing because we want to, that's an unfortunate diagnosis to have, but we really want to provide that service here so we can take good care of our patients. They can go home and enjoy the rest of their day. So as you can see, not only Frankfurt, when we look at the services that are offered in each location, other than the big H, you can see that in Manistee, we have similar things where we offer other services in addition to our hospital services, and in Cadillac. So again, lots of opportunity right here in the South region without having to go too far if we can't give you that service at Frankfurt. So this is really the overall graphic. It is a little busy. I'll just kind of hit the highlights on this. So we already talked about here in the middle that Munson Medical Center will be our tertiary care center, which means that our sicker patients will go there. Yes, you can go up there for testing and other things as well. And you certainly can be an inpatient there if you choose to be, but we're really looking at making that more of a kind of a funnel of all those sicker patients for us within the Munson healthcare system. And over here on the left is the South. So Paul Oliver is right here. Manistee is here. We are considered community hospitals, which means all the things that we already talked about, we can offer right here in Frankfurt or in Manistee. Cadillac is going to become our regional hospital. So if there's a diagnosis or a treatment that you need that's not offered either at Paul Oliver or Manistee, instead of always going to the medical center, we would look to have the patients go to Cadillac. And again, just because we can take care of a lot of the things, ICU patients and things in Cadillac, And another thing that the pandemic did for us is it made us realize that, you know, as different regions that we have, so the South region that we are in, we were able to really coordinate patient care throughout the South region. So if you went to the ER in Frankfurt at Paul Oliver and you needed to be admitted and we weren't able to keep you in Frankfurt because your acuity was a little higher than needed, you could go to Manistee and we could coordinate that. Our providers would talk to each other. We would make sure that we coordinated that care, or they could go to Cadillac. And Christy may be talking about this in a little bit, but one of the things that we just converted over to, actually the first of this month, is we went to SCP, which is a group that employs our ER providers. So our doctors and our PAs. They were an employed group in Frankfurt up until the 1st of November. And what's really neat about that transition, first of all, I think almost 100% of our providers stayed on. So you really don't notice a difference if you go to the ER today versus if you went a month ago, because the providers are the same. We have the same electronic medical records. So very little change that you'll see or feel. But the one thing that's a really big pickup for us is Manistee had a different ER group, Cadillac had a different ER group, and Paul Oliver had a different ER group. So between the three of them, we had 3 different ER provider groups that were providing that service. And there's just an increase in coordination of care and collaboration when you're all the same group. You understand each other, you have the same protocols. We don't all have the same electronic medical record yet, but we will within the next year. As we're doing that as a system, moving to Cerner. But there's just a great pickup in that. And some providers will go to Paul Oliver and Manistee, so they get to know each other. And it just really helps with that coordination of care. So if we call from Paul Oliver and say, we have a patient that needs to be admitted and we're thinking it would be a great fit for Manistee, they'll understand what Manistee can offer. They'll understand the person that's calling. And it just is that collaboration, which is really a wonderful pickup for us. So similar work that we're doing in the South region, we're also doing that in the East region, with Otsego being the regional hospital, and then Grayling and Charlevoix being the community hospitals that will feed into Otsego or the medical center. Yeah, so our Sound, which is our hospitalist groups that take care of you when you're in the hospital, and our THV group, are the same in Cadillac as well. So again, that collaboration and that understanding of protocols and just that relationship they have with each other really helps for that seamless, I think, coordination of care, which is really important. And some of these changes are going to take 1 to 3 years to implement. So this is a short-term and a long-term plan. As we make these adjustments, so of course, we're going to be evaluating, is it better care for our patients? And hopefully we'll say yes. And if not, we'll make adjustments. So it's not something that's going to be quick, and we're going to continue to look at what's the best thing that we can do for our patients and our communities. So what does this mean for us here in Frankfurt? I will tell you that at Paul Oliver, things are going to look pretty much the same. We've been a largely outpatient hospital for a long time. We've actually been proactive in adjusting over time to the needs of our communities. In Manistee, as an example, 85 to 90% of all the services that we offer in Manistee are outpatient. That means we still provide inpatient, but healthcare really is moving that way. And as we talked about in the beginning about really making sure you have access to keep you healthy and out of the hospital, truly is the goal. If you're sick enough to go to the hospital, we'll take great care of you, but we really, that shouldn't be the first choice. It really needs to be something down the line after we've done everything else to make sure you have all the care that you need. A couple of other highlights here. We don't anticipate any change in our EMS volume. We already have a great service here in Benzie County, so that shouldn't change. We're not taking away services. If anything, we're always looking to what can we provide more on an outpatient basis. Again, whether we have more visiting specialists that come to the Frankfurt Specialty Clinic, or more access to primary care, virtual care, and home care to continue to take great care of you. And we are always looking at what other specialists we can bring to the Frankfurt community so you don't have to travel to get that care. And we talked about Munson Medical Center being the tertiary higher level care provider for our communities. And really, the real goal of all of this is to make sure that we continue to be strong and vibrant in our communities to take great care of our folks. We look at, stats. If you look at real healthcare closures within our country, in the last 10 years, 163 rural health hospitals have closed. In since in 2020 alone, we had 19 that closed. Of course, the pandemic didn't help with all of that. Costs went up with supplies and medications. Staffing was a big challenge. It continues to be something we talk about daily. Because it's really hard to be in healthcare. It always has been, but really during the pandemic, a lot of folks decided, I don't want to stay in healthcare. It's hard. And exposed to so many things. There are a lot of uncertainties. And so we have weathered through those challenges, but they will continue. I think I'll go ahead and turn it over to Christy to talk about ongoing things that are happening at Paul Oliver, and then any questions that you have.
Kelly,
Thank you.
before you leave, can we ask you some questions now?
Sure.
All right. First, I want to thank both you ladies for being here. I know you didn't have to be. Quite frankly, when I read the article in the paper about the reorganization, kind of the red flags went up. So two-part question for you before you stand down. First, can you talk about the financial health of Paul Oliver? Because I know that you may be one of just a couple hospitals that are really in the black. And what's your thoughts about expanding long-term care?
I'll talk about the first, and then maybe I'll have Christy talk about long-term care because she's the expert. That is something obviously with the financial situation. That's one of the reasons too, why as a system, we're really looking to redesign our care. When prices go up on medications and when they go up on supplies, which they have gone up pretty significantly during the pandemic, and that continues. In healthcare, we don't raise our prices. We don't say, well, we're going to charge, $10,000 for something that was $8,000, a week ago. So we don't adjust our pricing, and we're reimbursed by our payers at a certain expectation, which they direct. So we don't get to decide those choices. So because of that, we have had to look at how we do things and continue to be efficient. At the end of the day, we're in healthcare to take care of people, but we're also a nonprofit organization. So any money that we make goes back into the infrastructure of our organizations, buying capital in big equipment pieces that we need, like a 3D mammography or those kinds of things. So it's really important that we continue to be fiscally strong, because we need to continue to put that money into our organizations. I will tell you, Paul Oliver is doing very well. We're lean and we're mighty. I think those are the two words I would use to describe us, but it is something that we are continuously looking at to make sure that we're making all the right decisions so we continue to be solvent financially for many, many, many years to come. And we have a lot of support from our community too, so we're very thankful for that. We have a very robust foundation that is very generous with us, and so we're always appreciative of them. I hope that answers your question, but it's something we're always looking at.
Understate that enough. Our foundation is extremely generous, supported us in a lot of ways that many other communities haven't. So I think we're very lucky that way. A lot of our state-of-the-art equipment has been given to us from our foundation and our community support. So I think that's one very good thing. I also think that we have been ahead of the curve. When you look at the big H's there, the other maybe meaning for that slide was healthcare is always, you think about healthcare as hospital care a lot. Healthcare is evolving. It is no longer hospital care. Insurers are pushing care out to the homes, and it should be. As much care as we get in our homes and in our home situation, we should be getting there. But payment is getting tough. It's tough to make ends meet. It just is. So we have to be very smart about how we do things. And this has really forced our hand in making sure that we are doing things appropriately and smartly, and making sure that our bottom line makes sense. And then I'll go right into long-term care, because that's the other thing that is really tough right now. Long-term care is extremely regulated. You guys probably know that. You also have your hand in that as well. And it's been a very tough business to be in over the last couple of years, especially with COVID. We are doing our best to control expenses, manage staffing, and make sure that we keep our census up to a point where we can break even. I believe we're back staffed well enough that we are making that happen right now. We are not talking about expanding. We're talking about what services we should be in, what business we should be in at this point, what makes sense for us. We're not talking about taking it away by any standpoint. We are talking about more skilled rehab at this point. So I think that's where we're at. So. Anything else on add? All right. It's been a tough business to be in. I gotta tell you, and you guys know that very well. It's from,
So I'm gonna do my best to make sure this stays in line. And it was shortly after the beginning of COVID. That the rumor was going around that Munson was on track to lose 30 million this last year or somewhat like that. I know they decreased a fair amount of staff, which affected our family, closed the department that affected my wife after 28 years. Some parts of that don't make a lot of sense to me. I totally get it, but the community doesn't know that. They do now, but it's a little bit late. Is there anything you can add to that?
about what we're on track to lose.
Well, I will, let me start out with kind of the more broad there. I was going to include a slide, but it was about a year and a half old. So I thought it was a little outdated, but when you look at systems across the country, Kaiser Permanente, Ford, Henry Ford, hospitals across the nation that are much bigger than Munson Healthcare, losing millions and millions of dollars. And we had challenges, financial challenges for sure. And that's part of the work of this is, we know we're really good at expense reduction. That's something we can control. We can control expense reduction and saying yes to patients that we can take care of. But we know that we cannot cut our way to making that right. And so all of the challenges that we have had, we've had to be really thoughtful about it's really about growth. That's really what it has to be about. It has to be about growth and opportunities. What can we take care of in the South region is what we can focus on. What can we do to expand services here so we can continue to not only take care of the patients we do now, but we can grow that base as well. So folks aren't leaving to go somewhere else. We want to take care of Northern Michigan. We're the biggest healthcare provider north of, I think, the middle of the hand. So we want to continue to make sure we take care of those folks and make sure that they don't have to go somewhere else. Now, we can't do everything. We don't do transplants. We don't do things like that. So some things have to go to other systems and we coordinate that care, as often as we need to. But at the end of the day, it is about growth and retaining. And really part of it has been a staffing challenge because it's really difficult to staff beds. If you don't have staff, you can't do it. And when you have many people that either retired early, went into other work or did remote work, which is not direct patient care. That's part of our job we're working with local colleges. We're working on job fairs. We're working on what can we do to bring folks in, and retention and recruitment is a big bucket of work that as a system we're working on, because it's really important to, recruit people. It's really, really important to retain people. We have wonderful, amazing people that have been so dedicated to this work for so long. We want to make sure that they want to stay and they want to work at Munson through their entire career, because we do. And we want to make sure that we provide an environment where people feel that they can do that. But I will tell you, the pandemic, I've been a nurse for 37 years. I've never seen anything like it. And my career completely changed a lot of things about healthcare that were really understood. And some of them were for the better, made us think differently, but some of it was hard. And we're working our way through that. I don't know if that answers your question, but.
Somewhat.
Okay.
And I think we're faring better than other systems, but to be honest with you, healthcare is tough. It's tough right now, and we're making some really hard choices. We will continue to do that. I think we're on the right track.
So, and this might be totally out of what you may know or be aware of, but at some point in time, the VA and Munson Healthcare had a pretty good arrangement, but VA wasn't paying very well back then. I don't know if you can elaborate at all or not.
So I am not very knowledgeable on that, but if there's something specific, I'm very happy to look into it for you.
Some years ago, there was a different style of payment going on, and the VA had redone some things.
Okay.
But apparently it made it kind of tricky when the billing came into the VA and it wasn't coded right, and then it got kicked back out. So some of the Munson entities hadn't been paid in quite some time, and we manipulated something through Congress to get that fixed. But like I said, that was 5 years ago, probably.
Okay. We certainly can do some investigation and get back to you on that.
I appreciate it.
Very well.
Yeah.
All right.
Thank you.
So I'm gonna do, just tell you just a little bit, and there's so much going on over at Paul Oliver, and I feel bad sometimes because I feel like people really don't know what's going on up on that hill over there. I feel like we're the best kept secret in Benzie County sometimes. But there's a lot going on over there. We are growing our outpatient services. And I want to just very quickly touch on some of them, and then I want to open it up for questions. One of our goals is to make sure that we are improving access to care to our local communities. And with that, we're working on primary care. And we have brought primary care providers, both physicians and nurse practitioners, to our communities, both in Frankfort and in Empire. Very happy to announce that we have 2 physicians, 2 nurse practitioners at Frankfort full-time. We are recruiting. It's busy enough over there that we are now having to recruit for another physician there. So we have Dr. Kuipers, Brandon Roos, Sarah Hoy there full-time. They are very busy. And I just have to find space for them now for another physician, which is a great problem to have. So really excited about that. Empire Family Care has Karen Volis there. Not sure if any of you have ever met her. She is a wonderful nurse practitioner. She actually had her own following and brought many of them there. She is got a huge practice. And now we have Dr. Hadley. He comes to us from the UP. He just started in November. He's going to be a wonderful addition to that community as well. I anticipate we'll probably be recruiting there within a couple of years as well. So really excited to have all of them. Like I said, just going to need to find some space there. I'm running out of room.
Christy, and so Dr. Hadley is a general?
Yes.
Okay.
Yep. We talked a little bit about our specialty clinics. And so again, bringing specialty care to our local community. These are the same groups that you're going to be seeing in other communities, the same specialists. So we have cardiology with THV. Dr. Reiki and his team comes down to see us here at the specialty clinic right here. And this is actually in collaboration with Manistee. So this building here is in collaboration with their team. We have Dr. Ducastle, who is a nephrologist who sees nephrology patients there. Dr. Fitzgerald, who does OB-GYN there. We have Dr. Galaze, who's doing urology and actually might be starting to do some small procedures at Paul Oliver as well. So he does urology patients at the clinic. We have Dr. Barry and Jake DeBoni doing orthopedics at the clinic there. And then we also have Liz, and I always get her last name wrong. It's Weigel, I believe. I never say her last name correctly. But she is doing advanced wound care, and that's a growing and very busy practice already. And there is so much need out in the community for this. And this is you can actually self-refer to that. So if you know somebody with wounds that are not healing well, they can actually self-refer to that program. A lot of diabetics need that care and they don't get it. So by the time we're seeing them in the emergency department, many times it's very late stage. So this is a great add to our community, and a lot of people don't know this. So glad to bring this here, and we're always looking for other specialties to bring to our community. We talked a little bit about the goal of bringing more virtual care. So one of the things that COVID did is it forced us to use virtual care. But one of the good things that came out of it was our virtual urgent care. Now this slide is old. I think we started using this slide July-ish. So we've had many more than 3,000 visits since this came out, but we do have a virtual urgent care now. And just a second, I'll show you how you can get to our virtual urgent care. But this has been a huge success. So people all over Michigan and in this area can actually use virtual urgent care instead of going to the emergency department if they have an earache or sore throat or those types of things that don't need an actual ER visit. They could actually use the urgent care here. This is how you access that. You would actually access it by calling our Ask a Nurse line. And this Ask a Nurse line, there's more information on the next slide, but it's now open 24/7. So you wake up with a child in the middle of the night, you're not sure if you need to go to the ER, or you can wait till the morning. You can actually call this line, or you can, they'll say, yep, wait till morning, or no, you really need to go to the ER now. Or they might say, yep, 7 a.m., go ahead and call the virtual urgent care. So they will kind of direct you on where you need to go. So this has been fantastic ad. With the ad of our SCP group out of our emergency department. And what I do want to mention about that is we very specifically at Paul Oliver went to using board certified emergency physicians and APPs. So we have a very talented team of physicians in our ED. When we went to SCP, they are also board certified physicians. So this group runs this Ask a Nurse after 11 p.m. So we have the Ask a Nurse during the day after 11 p.m. They are now running this 24/7 for us. So this was a very nice ad for our community. We have it available all the time now. It's been a really good thing and we're hoping people will use it. So again, trying to keep care close to home. Again, other things for that we're doing here at Paul Oliver, 99th percentile in our emergency department. This is unheard of. I just super proud of that group and all the fantastic things that they're doing. We don't do everything at Paul Oliver, but we do are very capable of taking care of our emergency departments and then relying on Tom's. So we have a good relationship with our EMS group as well. We are growing. July was the busiest month ever. And I did go back all the way to 2008 just to check all of the stats just to make sure, but it was the busiest month ever, both for ED and outpatient services. So again, we're continuing to grow and get bigger. We're always looking for other services. So if there's something that you think, hey, our community really needs this, we want to hear about it. We don't always hear that. So we have new state-of-the-art equipment in almost every single department. So we're upgrading all the time, making sure that we can serve you, the community, as we need to. We have 5-star dialysis and subacute rehab services. And of course, just highly trained. I'm always amazed at the staff that we have over there. Many of these staff members are certified in more than one thing. So it's not just, they amaze me every day at the care that they can give. So I'm going to stop here, open it up for questions, and then we'll talk about a little bit about EMS. I know that there were questions about EMS.
Good, yeah.
Okay, one of the things that I really have trouble with that 99 percentile in the emergency department, because one of the things that always bothers me when we go there, you could sit there half the day, 3/4 of the day, depending on what happens and stuff. Is it because you're overwhelmed because people come in that shouldn't be coming in and you're not prioritizing, or your staffing issues, but we've had some bad experiences and that's why we quit going to Paul Oliver and those kind of things. I'm not going to get into it, but I'm just curious if they have worked on trying to improve that ER.
So I don't know when the last time you were there was, but certainly I'm sorry to hear that you've had bad experiences. We always want to hear about those. What I can tell you is our average door to provider time is less than 20 minutes, even in our busiest days. Our average door in to door out time, even in the summer, is less than 2 hours. So under normal circumstances, now do we have to hold patients sometimes because Munson Medical Center is busy and they don't have a bed yet, or we're doing a 3-hour test on somebody before we determine what a disposition is. Yep, we have to do that sometimes, and that's kind of our routine. But we certainly want to know if there's an issue, and we have people who will actually help look at the care and make sure that there were no quality issues with that. That's how we make things better for the next person. So
Another question I have, did Munson go into using contract staffing during which everybody's had trouble getting employees? I'm just curious.
yes, during COVID.
So you were fully staffed by doing so? Is that?
So at Paul Oliver, I've always had full staff using contract. Yes. All over our system, I think almost all facilities had some level of contract staffing. Yes.
Is a huge additional cost, but.
Yep. And I still have
Just
contract
curious.
staffing
Okay.
in my long-term care. I have one left lab, I think.
Numbers have really gone down.
Yeah, we're
I
hoping for
anticipate
that, yeah.
that all my contract staffing will end by December.
Thank you. Appreciate it.
What else?
Can I just share, we're really happy to be here today and to hear things that are going well and things that aren't going well, answer questions. We're putting an article in the paper every month. That's a one read it. It's one-sided. There's conversation or communication. So we want to get news out to everybody about what's happening at Paul Oliver in the system, but sometimes it raises more questions than that. Please let us know what you're hearing. We're happy to talk to folks if they call or you get contact information. That's really helping, I think, to kind of ease the anxieties, but also get the real facts out there for folks to understand. So we'd be happy to come back whenever you'd want us back to really kind of continue the conversation, because I think it's important.
I hope it's not 7 years from now. Because I don't remember any representatives from Paul Oliver presenting, and I'm finishing up my 7th year.
Well, we'd be happy to come back way sooner than 7 years. You
So
let us know.
We would
Absolutely.
appreciate that, because we're partners together, so.
And if there's something that we know is going to be kind of, big news or whatever, maybe we can get ahead of that and be able to share that as
Yep, Karen.
Kelly Christie, I remember meeting you over at the fitness center. And one of the things you focused on today was keeping people healthy and trying to keep them out of the hospital, but you're there if they need them. Is there any update on that and how Paul Oliver is associated with that?
This is the fun part. This is really
Good.
fun. We, as part of our look at the services that we provide, we've had the Betsy Health and Fitness Center for a long time, sponsored by Betsy Hosick, a huge member of our community. And we made the decision, it was made at that time, that maybe we don't keep the fitness center as part of the hospital operations. We would support services there, but we did have it on the market for quite a while.
Right.
We had interest. We definitely did have that and worked with folks in the community that were interested. At the end of the day, though, we decided to pull it off the market, and we have plans in place where we're going to continue those services there. And an opportunity for growth for us as well. Getting some new equipment in there, which is helpful. So, that was a process that we went through when we found that at the end of all of that, we were going to keep it, and we're going to have a plan in place to make it sustainable for years to come.
To make it sustainable. Okay, that's what I wanted to know for sure, because I do get a lot of questions about that.
Yep.
You may remember we met there several times.
Christina, you betcha.
Yes.
So we're really happy about that. And part of that kind of plan in place is a rebranding that was blessed by Betsy Hosick. And it's Betsy Fitness, and it says Be Fit. And it's just catchy and really cool. And we're gonna have t-shirts and water bottles made up, and we're members. We want to make sure that, it is part of our long-term goal is always the health of our community. And so we're really thrilled that we were able to keep that open, and come visit us. It's really awesome. We really are excited about it. So we're looking at classes, what we can continue to support and maybe grow into different areas. So a lot of enthusiasm right now at the fitness center. So
thank you.
Very happy about that.
Thank you.
Thanks for asking.
Mhm.
Quick question. Do you anticipate any changes to the EMS scene, given that MMR just lost Traverse City as their primary transport service? Are they going to be trying to push more out to Benzie and Manistee, or just wondering?
Yeah, no, I think it's a really good question. Tom and I had an opportunity to talk yesterday. I don't anticipate any change in our service at all. Really, we were already down the road that this is on. So we anticipate that we're going to stay the same volume, the same transfers, everything should really stay the same.
Perfect.
So
Manistee is.
Was an MMRMA or MMR?
MMR.
Weren't they?
Leave off the
keep
other
adding
letters.
one, weren't they in Manistee also? Aren't they still in
They're
Manistee?
still, yeah.
We don't anticipate any change in our service in Manistee.
Okay.
Well,
I just wondered because they're losing Traverse City. So
Okay.
yeah, I don't know if you want to answer the question about the property.
yes. So Christy is going to address at one time when we talked about EMS Station 3 and the potential of maybe a piece of property there near the existing location that was talked about, and then it's kind of went dark for a little while, and so she's going to bring that up too.
So prior to COVID, and this was really very soon prior to COVID, Tom, and at that time, James Barker had started conversations about potentially deeding a piece of property to Benzie EMS for the construction of a new EMS building. As you know, the current building they're in is old. We've been very proud to be able to provide that kind of rent-free for a long time, but it's on its last leg, and we all know that. So during COVID, we kind of stopped talking about that, but the reality remains that we are still very willing to talk about doing that. You know, it makes sense that EMS would be in Frankfurt. We have 2 nursing homes. We have a retirement community there. Certainly we do between 30 and 50-ish transfers to Munson and Manistee out of that facility a month. So we are absolutely willing to continue conversations about that.
Anybody else?
I just want to make the comment that, and you understand this already, but I look at also the hospital from an economic development perspective. You know, the health of a community is often measured by the healthcare, the easy access to healthcare. But we're trying to ramp up our efforts on economic development. And I know from real life experience that one of the measurements companies look at is that access to healthcare. So I appreciate the fact that you're here and you asked for feedback. I wanted to mention that to you.
Thank you for that. And we will certainly very willing to come back anytime.
So it's exciting to know you're willing to reopen those conversations about the property. Do you have a time frame in mind or any sort of direction when those conversations will happen?
No, I think we are, anytime you want to have conversations, we're ready.
Okay.
So we just need our legal to be involved as well.
Sure. Thank you.
Yep.
Thank you both for being here, taking time for us. Appreciate it. So if it's all right, we're gonna take a short break.
I'm glad you asked the question.
You're unmuted.
Thank you. We're back in session. Jennifer, what letter are you? L. Been requested that we move L up to
C.
C. Anybody have a problem with that? Yeah.
Come on, Jen.
No.
Appreciate getting back some other pressing matters. I have a new hire in another office, so I'd like to get there and welcome her, so. Again, I'm here today just to present our annual agreement for extension services for 2023-2024. And again, as always, I continue to be grateful for the partnership between Benzie County. I know I've recently appeared before the board and shared some of our accolades over the last year, and I won't go through those again, but hopefully they're still fresh in your mind. But again, just the costs include the services costs include what was recently budgeted from the Benzie board. And again, just always continue to be here to add value to our partnership. So I'm always here for questions and comments.
Is there anybody that'd like to support Gary's motion?
Yeah.
I'll second Gary's motion.
Good, because I can't find it.
That the board-
Gary.
That the Board of Commissioners approves the agreement for extension services provided by MSU to Benzie County for the fiscal year 23-24 in the amount of $45,712 with funds available in the general fund and authorizes the board chair to sign the agreement.
Thank you.
That's good, because I looked it up and I couldn't find anything in it, and I was. hitting
That's
the
second
wrong
time
spot.
today.
It's because they've moved us, because I was on L, so
You
I'm
were
sure
L,
it's
yeah.
scrolling
No,
down.
no.
Oh, thank you. And it's a privilege for us to be able to do this. There's a motion in support.
Wait,
Is it-
who supported?
Pardon me?
Oh, Kevin. Okay.
Yeah. Is there any further discussion? Rhonda? you had
I would
something?
just ask, so when COVID hit and you went virtual for a lot of your services, where did you land on that? I know we've found that it's a benefit for a lot of people to be able to access what you provide by computer, but there's also a need for things to be in person.
And
So
we
was
can
there a middle ground reached?
Well, yes, and that's a great question. So what we found is at least COVID taught us a valuable lesson that people want to access our programs at a convenient space for them. And for some people, they can choose to access those from their own home and watch our pre-recorded or our live opportunities, but we still continue to program in person as our primary methodology. If a partner were to approach us, so let's say, for example, like Munson Medical Center approached us and wanted to co-do a class. So our first question to them would be, tell us how you would like to deliver that class. What is the primary goals for your audience? So we try to do it according to the audience goals rather than our personal conveniences or our personal desires. It would be maybe whatever is the personal goal of that audience. You're welcome. But we feel our reach has increased as a result of COVID. I think I had shared last time that the sheer number of people accessing programs in Benzie County is increased. Like we couldn't keep up with that volume if a human being came to the Gov Center and delivered a program all those different times. I mean, it would just be we don't have enough manpower. So as a result of the diversity of our programming, either videos or live streamed or online classes or in person, it's increased the unique classes that residents are able to access. So. And it's all stored on our repository, so it can be accessed for future times.
Yeah, I think folks got used to that. It's almost a little frustrating when there are meetings or services. Why can't I get this online?
Yes, I
Almost
echo
expect it
that
now,
sentiment
right?
a bit now too. I
Right.
think I've gotten a little bit, it makes me maximize my time to be able to do things virtually for sure. I had a doctor's appointment this week and I was like, yes, sign me up next year for virtual visit because I could do it right from my office. I didn't even have to leave. I didn't have to go park. My productivity has increased myself. So personally.
Good, thanks. Any other questions? Roll call, please.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
Rolas.
Yes.
Motion carried.
Thank
And
you,
I
Jared.
did want to say that we have selected our replacement for Dana. So she will be starting the next few weeks. It was kind of a tough search to find someone just for a couple of days a week, but we did find a great candidate. And so she's going through our vetting process right now, background check. So we feel like she's a good candidate. And one of our no thank yous that we had, I did share with Katie, he had a really strong background in IT. And he just wasn't as good of a match for our office. We were looking for someone more with design experience and Facebook and that kind of social media presence, but he has a very strong background in IT. And so I told her that I would pass his information to her as a potential idea for a contractor.
Appreciate that.
Yes, no problem. But thank you so much and have a great rest
All
of your
right,
day.
thanks, Jennifer.
Happy Thanksgiving.
You too.
Hi, you too.
Next week already.
It is, isn't it?
It went
I believe we're
fast.
at item C.
Yes, so we are now moving on to the ad hoc committee for the airport authority. You want to talk about it, Rose? So the airport authority has one term that's expiring, currently held by Corey Carlin. We have advertised for this position for quite some time now, and we only have Corey's interest in being reappointed on the books. Policy does allow you to simply reappoint if you've shown your due diligence, which we have. So today there's two motions in front of you. You could either establish an ad hoc interview committee if you'd like to do further recruitment and interviews and such, or we could simply reappoint Corey Carlin to the airport authority.
How many board positions are open there now?
Just one.
Just the one.
Yeah, just Corey's.
We have Corey and then liaison. That what we have to do.
And then there's, Frederick. There was one other position. I don't recall his name. That you guys, there's, free, putting the liaison. My only concern, and it's been pointed out to me, we seem to be kind of blindsided with what's going on over to the airport. So we're not being, this board's not being kept up to date. Not a big one of raking somebody over the coals, but maybe we should consider bringing in for an interview and see if we can open a better line of communication with that group. Because there could be some pretty bad things coming down in the
How
future.
often do they meet?
We meet once a month. I'm the liaison from the board here. And in my report, I did put quite a bit of information that I will be touching base there. But to speak for Corey, I mean, he has taken this airport from being provisional to being a general airport, where that opens them up and they get funds for that and grant money for that, which I didn't go into too much in my report, but they have come a long way. And I did reach out to Dick Bayer, who is the director, and I said, I need to have more information because of the feeling of being, what did you say, blindsided about possible liabilities with this.
The pending lawsuit, I guess is how
Mhm.
I'm looking at it, and don't need to know it all, but this is a huge liability for the county. Just one of those
Potential.
things. Yeah,
Yeah, not,
well, even by all the other money he's bringing in is depending on what happens in the future, that could be a liability to the county too, because we consider leaving or whatever, there may be some money that has to be exchanged to do so. I just feel like I'm not getting the full story is how I'm looking at it.
and I would say, oh, I'm sorry, Gary, I
Go
didn't. I would say that that would be probably more on me. I will take the hit on that and not how the authority is being managed through their board and with Corey. When there were closed door sessions and I didn't question it about, I wasn't included in that. And since then, and maybe those are rookie mistakes, I don't know. But I would not say it's on the management. For that reporting, I would take the hit on that and be,
I'm
and say to be
glad you
part of
want to
that.
do that, but I don't feel it's your responsibility. I think it's Corey's responsibility to inform this board any pending problems. We can have a closed session in there with him.
Potential problem. not
Well,
pending.
potential, but it sounded more like it's gonna happen, but I am not completely up on this, and that's one of my concerns. We should be. What's going on?
But
So,
one of the other things is the money, they will be getting the money that they need. From my understanding, it hasn't been received yet. And there was an interim period, again, from my understanding, it's maybe a month, maybe 3 months. And that's why they came to us as a board.
Gary, now you're talking about the 150,000.
Yes.
I think Gary's talking about the potential judgment or settlement that they're entering into, and that is moving forward.
that is moving forward. I was not privy to that.
And Karen, just full disclosure, you and I had a discussion.
We did.
And no, when they tell you that you're not welcome into a closed board meeting, you don't know that you should have said, look, I'm an owner. And I'm going to tell you that if I'm an owner of a company in the private sector, my board can't keep anything from me. So I don't need to take that bullet. I'm with Gary. Other than Gary, I'm going to tell you that I think I need to know all of it. I mean, we could potentially be the backstop for liability. As we've learned through this whole process, we always thought there was 3 owners. Really, Crystal Lake Township is more voluntary because they're not contractually obligated to split 1/3 of it. I think Corey's done a yeoman's job.
I do too.
With running the airport. He was left with a mess there. And most of you probably don't even know how bad it was because there was no communication. However, though, I want them to feel the responsibility of being accountable to us. And I don't know how we get there without, driving it home through an interview or whatever that might be.
Can't we request minutes of their meetings that are not closed session and have them available to know what kind of decisions and who's doing what and how and when?
So there's a few ways we could approach this. We could ask them for their minutes and we can include them in the packet. After every meeting, the other thing you'll recall is that during all of our conversations with Corey and Dick, we talked about cleaning up that MOU that we have in place. And that would be a way that we could hold them to the fire, as per se, is part of that MOU is they would be required to report to the county, the city, and the township, quarterly or biannually or whatever motion we come up with. That MOU could require them to report on what's going on whatever timeline we want them to all 3 entities. Because in my conversations with the city of Frankfort, they too felt a little out of the picture and wanted to know a bit more about what was going on. And so, I had sent them all the things that I had and sent them links to the YouTube so they could listen to Corey and Dick talk at our meetings. And so I think that might be a really good way for us to put that in place is that MOU, we say you have to report to the 3 entities on whatever timeline we want so that we're kind of kept in the loop on those things.
I do get some of the minute. I don't remember what the most recent. I do it with them. I can be more on top of getting those and making sure that it's just guys, if that is what you guys like.
Hang on just a second, Michelle. Okay. There you go.
And I think it's great that it's available, but as we've moved through these processes with the Maples and the Transportation Authority, I believe that we need to have them in here, at least once or twice a year. I don't want to see them 4 times a year, but shouldn't have to go search for the information.
Well, and this was news to me, your comment, Art, about Crystal Lake being a voluntary member. It was my understanding we were 3 entities who formed the authority and responsible 3 ways. So that revelation right there was news to me, and I was not aware of that.
So
I'm representing that correctly, aren't I?
You're being correct. So the authority was originally created between the city and the county only, and there's an MOU that reflects that. The law states that an authority can add an additional member by resolution, of which they did. However, that local MOU, which establishes how much we're paying and contributing towards the authority and our different other rights and responsibilities outside of the authority, was never updated. So they're a part of the authority in the sense of they have a place on the board because of statute allows that. But that local MOU, which holds them to the standard of who pays what and who contributes what, that was never changed to include them in that relationship.
So they are a member in name with no fiscal responsibilities.
They do have a fiscal responsibility that they agreed to, but it's not in contractual form, no.
Voluntary. They may not.
So part of this whole conversation, we've discovered this. And so we've said that, when things settle down, because they're working on a few things there, we're going to really look at that MOU and beef that up and include Crystal Lake and include those different expectations in there. so that we're all equal players in this game. Yes.
But with those understandings that we're gonna move forward with an updated
Yes.
MOU, and I'm assuming that they won't debate us on that.
I would hope that.
I'm gonna make a motion then that the Board of Commissioners appoints Corey to the Airport Authority with the term expiring. Is it really 12/31/27?
They're 4-year terms.
Period. With the understanding that the MOU is going to be updated in the next 12 months.
Sure.
Yeah, I would support that.
There's a motion and support. Is there further discussion?
He's right.
All those in favor say aye.
Aye.
Opposed? So moved. Establish an ad hoc committee for Benzie, Illinois Health Department.
There's only one, reappointment, and he submitted his reappointment application. And, I recommend going with him too. He's been doing it for a while and he submitted first.
I'll make that motion that the Board of Commissioners appoint Dr. Kuiper to the Benzie, Illinois Health Department Committee with terms expiring December 31, 2025. Dr. Kuiper reached out to me at the last meeting and he said, I'd be more than happy to serve on here. If you have somebody else in mind, I will step aside. And he's been a great asset to that.
I'm happy to second that motion.
Thank you.
Happy to have him.
And he did reach out to me and we had a conversation with that same sentiment that you're saying, so he would step aside if, but
Glad to have him.
yes.
All right, there's a motion and support. Is there further discussion? All those in favor say aye.
Aye.
Aye. Opposed? So moved. Item E, ad hoc committee for EDC BRA.
So we have Betsy Evans' term expired, as you know. We kind of went through this transition of appointments for the different boards and committees, moving from the clerk's office to administration. And so quite frankly, Betsy's reappointment was missed. And so it's before you now. We've advertised for this position for quite some time now. And we have only received Betsy's interest in being reappointed for this committee. In all of our research into this, we were looking through, as you know, EDC and BRA were combined into one. Their bylaws, though, haven't never been officially combined. And so there may be one more spot, but there may not be, depending on where things land. Because they have different number of people serving on those two respective committees in their respective bylaws, but we've never finalized those combined bylaws to establish a set number for this combined committee. So what's in front of you today is to reappoint Betsy Evans, and we will be talking at the EDC level about this bylaw and makeup issue because we need to get to a conclusion on that. So we know exactly where we're at as far as how many people are serving on this committee. If you all know of anyone who wants to serve on this committee as well as others, we really are we're not getting any interest from our community. We put them online, we put them in the Record Patriot. I even put it out there on over here in Benzie County. We're just not getting folks. So any conversations that you can have with those in your respective districts would be really helpful. We don't want to always just forego the policy and reappoint. We want some variety out there.
So I'm going to preface my question with how much we appreciate volunteers in our county.
We do.
Is Betsy Evans in good standing with regard to attendance?
She has missed quite a few meetings. And our policy does say those who are missing meetings have chance of being removed or not reappointed.
So I had a similar concern also. And what I'm going to recommend, if you look at Betsy's resume, she would be someone, under any other circumstance, would be recruiting her
Sure.
for the position. And I think that that attendance needs to be addressed at the first of the year when we're appointing officers for the EDC
Mhm.
and insisting that we get people at meetings. Part of our challenge has been, as I did a review, is we've changed meetings around to accommodate people.
We have.
So if you got it on your schedule and it's being changed and now you're not able to make it, but we have to have that quorum there. I also want to speak to your comment about finding people. I'm a firm believer, and I've said this repeatedly now for years, recruitment is much more effective than posting in a paper. Dr. Schaefer will tell you that because we've reached out to him more than once, and now we've got a strong board. I would ask that we push that back to the EDC committee.
Mhm.
We do have one position that's held open because we were holding it open for the chamber,
Correct.
which never developed. And I can tell you that the chamber would probably love to have a place on that board. So if we could address this kind of in two steps,
Mhm.
the reappointment of Betsy, and I'm going to make that motion that we reappoint her to the 6-year term expiring 12/31/28, remembering that we're a year behind.
Yeah.
So that's not, it doesn't look like it's a 6 full years, but it really is. And I'll stop there for a moment.
Second.
There's a motion and support, further discussion. Hearing none, all those in favor say aye.
Aye.
Aye, opposed?
I'd like to follow up with that thought that would instruct this board to have the EDC come together and take the task up of first cleaning up those bylaws, because you're right, they never did get merged properly. They were talked about.
Mhm.
And secondly, recruitment for their committee. And Bob, I believe that you have the authority just to make that happen. I don't think that has to be a board decision.
Oh, I wouldn't think so. Make it happen.
Well, this board did take the action of making a certain level of attendance required. Is our new reappointed members made aware of that policy, that that's something that's kind of expected based on the sense that generally the seat's being given to someone when others are applying as well. I
Who
just
shared
want to
that?
make sure that the attendance piece of it is being shared with new candidates, that, you know, while we appreciate your interest in applying for this, there
I
are.
have not put it in the acceptance letter. I can start putting it in there. I always put that whoever's the board liaison to contact them if they have any question. And then whoever the chair is, and sometimes it's the same person. But I don't specifically point it out, but I can definitely start doing.
And I think that we need to do a better job of orientation with our committees.
Right. And so when we did this policy, that was one of the things we talked about, is that chair or staff liaison is the one who notifies those new people of the rules, regulations kind of thing. And so it's been up to those folks to be doing that.
Specifically an issue in this situation, as she serves as the chair of that committee.
There's that.
And then there's that.
So we will just add, I think what we'll do is we'll add a blurb to our appointment letters that we're sending out. And we typically do 99% of those via email, so we can just attach the policy as well so that folks have that. And, we'll start doing it that way. Yeah.
Alrighty. Next is establish an ad hoc interview committee for solid waste committee.
So there's 3 reappointments on this committee. One of them has expressed to not be reappointed. One has been expressed, Annie Brownie has expressed to be reappointed, and then we have not received any others. Last night, I did get forwarded one from Tammy. I have not had the time to look it over or anything, but I would recommend to do an ad hoc so we can talk about applicant and get them in for an interview if. And we have, again, posted for these for a very long time and tried to get more people to come in to serve.
Rose, the recommendation that you have here, do you have it in front of you?
No, I do not. I can,
You may want to take a look at that. Looks like some cutting and pasting happened.
Oh, my bad. Sorry.
Okay.
I completely missed that.
So the motion would be correct other than inserting solid waste
Solid
versus
waste, yeah.
over top of Benzie Illinois Health Department.
But since there's 3 openings, I'd like to make a motion that we reappoint Annie.
You can
Or
do that.
I didn't even read the whole thing, and then set up the interviews for the other people.
And you can do that.
That's what I just did. That's my motion.
And I'll second that.
Thank you.
And do we have other people? Then we have one other
We at
person.
least have one.
Yes.
Yes.
So on that ad hoc committee, typically we have the chair, someone from my office, and then 2 of you need to decide who wants to also serve on that ad hoc interview committee.
I heard Evan say.
I saw him waving his pen. So Evan, and then anybody else, and
Yes, I
Karen.
would serve on that. Yes.
So those 3 would serve.
Would you guys want Bessie and on the
Yes.
interviews?
Baustra.
Okay, we have a motion and support. Is there any further discussion? Roll call, please.
Worsakki,
Yes.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Bowers,
Yes.
motion carried.
Item G, consider approving the purchase of 3 patrol cars for road deputy operation.
So in your packet, you have a memo regarding the purchase of 3 vehicles. These are road patrol vehicles for our deputies. These have been scheduled to be purchased. One of the 3 is a replacement for the vehicle, as you know, that was totaled out this summer. The other 2 are replacements of ones that were on our list.
Janat moves that the 2017-18 Charger is detailed in the memo from the sheriff dated November 2nd, 23 be declared surplus, authorized for sale on MI bid, internet auction system with proceeds to be deposited into the 425 equipment replacement fund, patrol car and expense, and to purchase 3 new patrol vehicles not to exceed 195,000 coming from the capital fund and the 425 patrol car expense.
Second.
Car that was totaled, was there not insurance on it?
Oh, there's absolutely insurance, but it's not enough to replace the vehicle. No. It was one that was near time to retire, or maybe it was time. It was near time. So it was an older vehicle. It wasn't one of the brand new ones.
What'd we get for insurance on that?
You remember, Greg? I don't remember off the top of my head.
The older vehicle. It was several $1,000s. Not,
Yeah,
I don't have that right in front of me, but
I don't remember.
something in the back of my mind says around $4,000 or $5,000.
Oh,
Yeah.
4 or 5, because
It was an older Charger. It wasn't one of the newer Durangos.
it's this, your proposal is 65,000 per vehicle.
Mhm.
I see that our budget was 60,000 per vehicle, but I'm not worried about that. But really, it's gonna be something less than 195 because we have insurance money to spend. Or
Right.
is that already included in the
So the motion
425 equipment replacement?
Yes, so the motion has the 2 different funds. In the capital fund, we have budgeted 60, but then there's funding in the patrol expenses replacement line as well. And so the funds come out of both of those accounts or both those funds. So that's why just looking at face value in the budget, you may get a little confused because of, things are coming from various pots of money.
And this amount purchases the vehicle and equips them to your needs, is that correct?
That is correct.
Yes. The whole kit and caboodle.
Okay, Boodle.
Oh, motion and support. Any further discussion? Roll call.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
Roloffs,
Yes.
Bauer,
Yes.
Worsakki,
Yes.
motion carried.
Item H, consider approving the purchase of 1 vehicle for drug enforcement operations.
So this one is specific to drug enforcement, or TNT is what it's commonly known as. You as a board during the budgeting process agreed to replace this vehicle as well and support the replacement of that vehicle because there was not enough funds within the TNT fund. And so you'll notice that some of the funding is coming from TNT to support that replacement, but then the rest is budgeted within the capital fund to support the replacement of that TNT vehicle. It is my understanding that that vehicle will be repurposed and not sold outright. So it will be utilized for a different role within the sheriff's office.
It's a plane car.
Yes, this is the plain car. It is a Durango.
And you have these three prices. Is that what I'm looking at? Or am I looking at the wrong ones?
So this.
The highest price was a Durango, 45,959. Am I looking at something wrong?
Yes, the Grand Cherokee Laredo is the 42,756. That's the TNT vehicle.
And the GMC was 44.
And
my
that's just the
concern
base
is
vehicle. That's not to
TNT
equip
should be
things.
paying the whole freight. I know they don't ever have enough money in there. Is there a way of taking 20 grand from 'em for the next 2 years out of that? Or does that come up for a vote again?
So you as a board, as part of the budgeting, approved this setup to purchase this vehicle this year. In future budgets, we can work on that. Yes. So you'll
They have a
recall,
tendency to overspend their account, and that's been a concern of mine.
well, you'll recall prior to 2 years ago, the general fund was taking a loan from the TNT, or not a loan, but taking funding from TNT to support positions within the general fund, which was then maximizing what they had. And so they couldn't really set money aside to plan for this sort of transaction because that extra money prior to 2 years ago was always transferred into the general fund to support activities within the general fund related to that millage. We don't do that now. We're leaving that money within the TNT so that they can create a fund balance to purchase their own vehicles. But you were limiting them in that ability to do that prior to 2 years ago.
So if I understand you correctly, we were appropriating money that was supposed to be used for TNT for something else, or am I misunderstanding that?
So under prior administration, that funding was coming into the general fund to support activities related to the TNT or drug enforcement millage. So it wasn't just being thrown into the general fund for giggles. It was to support activities related to. How that was established, though, was prior to me. So I don't know how that number
I
was
would be very
established.
curious to see where it was spent.
It went into the general fund coffers.
It should have never done because it should have been set up.
Well, you can take administrative fees to, support those things, because we do that. We budget
Well-
administrative fees from, the jail and the other things. So you can do that. But this was in addition to, and so it was prohibiting their ability, or I think that's the right word, to save money for a purchase. But now a purchase needs to be made, and as part of this budgeting, you approved as part of the budget to pay for roughly 2/3.
So in
of
the
that.
future, we are going to set aside money out of that account?
That would
to do
be,
so?
that's our plan and that's our goal, is
Okay.
they would be able to support their own
They should be
replacement
able
in the
to
future.
support their own, yes.
Yes.
Okay.
Each of those
Thank you.
special activities, in my opinion, should have a capital account that's anticipating these kinds of things. What I'm hearing you say is, although the monies are being used for qualified activities, it ended up in the general fund to be paid for rather than TNT, which then didn't allow them to grow their surplus.
Correct. So the 20,000 is the max that I would recommend taking of what they have set aside, without completely depleting what they do have.
Well, what is their surplus?
Oh, gee, let me see.
May I ask a couple questions that I could ask the deputy
Under sheriff, sure.
under sheriff?
Oh,
On here, it says that this is for purchase of an undercover drug enforcement car. How many do you have
We have one,
for undercover?
yeah. That is used by the TNT office. We have two
Okay.
other vehicles that are used by the detective bureau, and our hope is to move that vehicle into the detective bureau fleet as one of the detective cars right now. The rear end is gone and we're limping it along, but it's on a
So you
day-to-day
don't-
basis.
So you don't really use undercover that much?
For the TNT officer, we do for that vehicle.
Okay, so that's what I was trying to understand when I had a little briefs, as one of my careers. And when we did undercover, we used to switch our undercover cars all the time. And they were beater cars, because what's the point if you've been burned, they already know. So is it effective as an undercover car for you doing it this way?
It is. The state supplies vehicles for the state employees, for the troopers that are assigned into the TNT unit. They do not assign them for our deputies or city officers that are assigned to the TNT unit. TNT had a very specific request on a make, model, and design, almost down to the color of what they wanted to offset what they currently have in their fleet. And we're trying to fit that.
As long as it's effective as an undercover car still. That's what
So I know what you're talking about, and without
Going too deep.
going too deep on what
No.
TNT does, I
That's
can
fine.
talk to you after.
Yeah, let's do
To
that.
allay
then,
your
Because
concerns.
when I read through this, that's where I was going. I thought, undercover is what threw me. And I only opened this up because it was we had a little lapse. Sure. Okay. We'll talk
So
later then.
after the movement is made to capital to support the roughly a third of the purchase of this vehicle, it leaves about $36,000 in their fund balance, which is right around 20% of their total budget.
So I just looked at the TNT capital budget. There's nothing scheduled out for the next 5 years.
Did you look at the yellow page?
Yes, I did.
That's
For
great.
just automobiles. I just looked at it for autos. Where I'm going with this is, do they have things anticipated for next year or the year after that we can't use some of those funds?
So TNT 60, it's on there on the second page.
Okay,
So it was scheduled,
oh, the car was scheduled?
correct?
Okay,
And you approved it as part of the budget process, because part of the budget, if you recall back to the draft budget with the notes, it specifically says that a portion's coming from TNT and that the board would need to approve that remaining roughly $40,000 to complete this transaction. We could have taken more from their fund balance, but that gives me real heartburn to completely drain their fund balance. And that's why we included it as part of the budget of moving over 40,000 of general fund to support this purchase.
so Katie, I get that. I was looking at both the the ARPA fund and
Oh.
the 5-year plan, the one that's at the top.
Yeah, yellow is vehicles.
Yeah, I get that, but my question is that I don't see anything else planned for the next 5 years for other expenditures for TNT. So why do we have to maintain a 20% surplus if there's no immediate plans for that? Like we couldn't use at least another 15,000 or so for the purchase of this vehicle.
It's up to the board.
But you understand where I'm coming from, right?
Yep.
Okay.
We try to maintain right around that 25% fund balances for our various funds. I'm operating under the policy that you put in place is why that's what I left within that fund balance. If the board wants to be in the habit of having a smaller fund balance and borrowing from other funds or giving from other funds to support those special millage funds, sure. The only trouble with that is it's going to muddy the clear picture of the true need when we set those levies as well.
So you're saying you think that money will be needed to balance the TNT budget for next year?
Not necessarily needed to balance, no, but if there's something that comes up, we have that funding available to take care of those unidentified crazy needs that we might have.
And one of the concerns I always have regarding surpluses is I'm okay when there's planned uses.
Mhm.
But we have no planned uses for the next 5 years based on this plan. And I'm not saying we deplete it, but I'm wondering is maybe it makes sense and I wouldn't want to make this something we do all the time. But because there's no planned uses, maybe now's the time to take additional money out of there to make this purchase. And it'll still leave 15 or 20,000 in there, but
You could, but you're setting precedent. I'm working hard to build a jail fund balance because that was allowed. They were allowed to deplete their fund balance. And now it's been how many years? And we got like $30,000 in there and I'm proud of it. So, we could do that, but we're setting precedent to drain fund balances, which I don't like.
Would it accomplish what you're trying to do by instead of taking money out of the fund for this decision is rather adding to the capital needs on year 4 or 5 that another car is going to be required? I mean, isn't that the lifespan of the car? And if that need is projected out, then we know why the balance exists.
or equipment or something.
But what I hear you saying is there's not an identifiable need. So could we create that because we know it's going to exist and it's an excellent catch on your part, but obviously one that's easily remedied by realizing that we are going to have to replace the car we're purchasing right now within the next 4 to 5 years. Is that a fair time frame, Under Sheriff?
It is. I would say it's 3 to 4 years in the mileage on that vehicle.
And there's other needs. These capital plans, I'm dependent upon our various departments to provide me the information to what goes on these capital plans. And we do a very, very good job. But as you know, these plans are constantly improving every year because it wasn't quite a thing. And so there's still a bit of a learning curve and to provide me everything you think you're going to need in the next 5 years. And so there may be things on that list that the sheriff's office didn't give me, but they have it on their list. And so there may be things to add to that list. I'm sure there's things to add to that list. It just may have gotten missed on the list.
Shelley?
There's also the ability to assign fund balance.
That's what he's talking about.
If there's $36,000 remaining in the fund after this purchase, you could assign 20 of that.
That's exactly what I'm talking about. And Katie, I get it. I think, I've told you repeatedly, I think you guys are doing a good job. And I know you're playing some catch up. But as a board member, all I can rely on is what's in front of me.
Mm-hmm.
And so my immediate reaction is, next 5 years don't look like they have a real need. So why are we taking money from the general fund to do this?
Mm-hmm. I understand.
To your comment, Rhonda, sure. I mean, if there was things out there identified, and now we've already heard that maybe in the next 3 years or 4 years, we'd have to replace it, and we've got to begin setting money aside for that. I'm all in favor of it. All I'm doing is working with the information that's available to me today.
I agree.
That's all.
Yeah.
So we're gonna keep discussing, or we're gonna go forward with a motion? Not yet.
No.
Consider approving the purchase of one vehicle for drug enforcement operations.
So the motion within the packet is to purchase a new drug enforcement vehicle in the not to exceed amount of $60,000, with 20,000 coming from contingency and TNT and 40,000 from capital.
We add with an addition to the TNT capital plan of a future car purchase within the next 3 to 4 years.
I don't think you need action. I mean, I have them in an Excel spreadsheet. I could add it right now. And I'm guessing based on the conversation that the undersheriff and the sheriff will say, oh, no, we have ideas. We just didn't give them to you. And so I would anticipate from their office, they're going to say, no, we actually need these things in the next 5 years, whether it's a bulletproof vest or whatever. I'm guessing there's things there. They just aren't memorialized on that capital plan at the moment.
It has just occurred to me that $20,000 is coming out of that surplus, yes or no?
So we budgeted so much money to come from TNT. So 36 is what's going to be sitting in fund balance. And remember, that's a snapshot in time from 9/30. That 36 will be within fund balance because we've budgeted just over 20,000 to come from TNT to
Okay,
pay for that vehicle. So 36 is what's going to be left.
left, okay. All right.
Mhm.
Is this an opportune time to change this to 30,000 each,
It's up to the board. They're welcome to do that.
just to see where it's gonna play out, or?
You know, I'm not trying to punish anybody, all right, but admin can only operate on the information that they have. And Greg, I know you do a great job and you guys are all playing catch up. But we talked repeatedly about making sure, you know, that we're being good stewards of the money. And unless somebody tells me that that money is going to be spent differently somewhere else, yeah, take another 10,000 out of there. That leaves 26,000. If you put 20,000 aside each year in the next 3 to 4 years, that gets you in a position to be able to pay for that next vehicle.
I'll make this motion stipulation that 30,000 comes out of the TNT contingency and 30,000 comes out of capital improvements.
And that you approve the related budget amendments to make that happen.
Yeah, that too.
I'll second.
There's a motion and support. Any further discussion? Roll call.
Janat,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
motion carried.
Thank you. Move on to item I, consider approving remodel to the men's and women's bathrooms on the main floor.
And so to be specific, this would be the bathrooms outside of administration in 206, not the ones that are right outside this room. This would be to renovate both of those bathrooms, the men's and the women's. And this is floor to ceiling renovations. Most of the work being done will be done by our maintenance coordinator person. He also many times enlists the help of folks who need community service for parole and probation reasons, which then helps him as well. Those bathrooms have been talked about for quite some time and they've been on the capital plan every year since I've been here. So we've been saving money for those 2 bathrooms. Within your packet today, the one element that is over the spending threshold is going to be the plumbing part of it, so the fixtures, the toilets, the sink and those sorts of things. And you'll see in here that there are 3 proposals for that element of the work, and we are recommending going forward with the low bidder on that element. This remodel will close those bathrooms for probably about 2 weeks. And so everyone will have to use the ones outside of this room here.
Or
For
in
the
the
visitors room or in the basement,
Sorry,
the first
on the first
floor,
floor.
the one person who gets after me about the basement. The bathrooms on the first floor as well. And so, like I said, this is floor to ceiling. So this is the ceiling tiles. As many of you know, they're pretty nasty in there. The floors, the fixtures, the panels. I'm sad that pastel 1970s pink's gonna go away, but you know, we gotta come into the 21st century. So there is a motion in your packet.
So I'll make, excuse me, I'll make a motion that the Board of Commissioners approves the remodel of the main floor men's and women's restrooms near administration of the governmental center in the not to exceed amount of $25,000 with funds available in the capital fund and American Rescue Plan Fund, and authorizes the administrator to sign the appropriate proposals.
Or
Motion and support. Is there further discussion?
And the Building and Grounds Committee discussed this and you're recommending it, is that correct?
So this was brought forward to the Buildings and Grounds as more of an update, and this is what's going on. As you know, there's been some hiccups in the processes around here when it comes to obtaining proposals and such. There's an old way of doing things, there's a way of doing things, and there's going to be a new way of doing things because we've identified some of those deficiencies in the process that we know has caused some conflict in the community. The Buildings and Grounds Committee is looking at the process and the procedures and the policy for obtaining RFPs and proposals for Benzie County. So this is one of those that was really started under the old process. And so this sort of process won't happen again. is basically what I'm trying to say. So it went through the buildings and
I've got it
grounds, but
written
there
down if
wasn't
you want to read it.
formal action. I was really wordy for you on that one. There was no formal actions, but it was brought up at the buildings and grounds. Going forward, though, all these things will receive official recommendation from the Buildings and Grounds Committee.
Thank you.
Motion and support. Anything else? Roll call.
Nye,
Same.
Roloff,
Yes.
Sauer,
I'm concerned with her abstaining. This is not anything to do
Nye
with,
Plumbing and Heating.
because they put in a
I
bid.
wouldn't vote for it and I won't vote against it. So I don't think I should be a part of this vote.
You really shouldn't be. Your family business is in the package, and so I think you're doing the right thing by abstaining.
Worsakki,
Yes.
Cunningham,
Yes.
you're not,
Yes.
motion carried.
Item J, consider accepting proposal from Western Detention regarding jail control room door.
You know more about it than me.
Okay. This was an item that was budgeted in the 23-24 fiscal year budget. This is the control room door from the control room in the jail operations center to the actual jail. This is controlled both by a physical emergency knob and an electronic lock. Right now that, we've been putting this off, for a while. Right now that knob only moves one way. It doesn't move to the right to open the door. It only moves to the left. It's just a handle knob. If it no longer goes to the left, we don't have any access to that door. This is a security door that keeps the outside jail from inside of the control room in between those two. It's a two-part bid, both for the lock itself, from Western Detention, and the installation of the electronics to reconnect it back to the board. And that is with Johnson Controls. Johnson Controls is very proprietary with Western Detention and the locks that we currently have in our jail.
Janai makes the motion that the Board of Commissioners accepts the proposal from Western Detention, Johnson Controls for replacement of the dead latch on the jail control room in the jail in the not to exceed amount of $6,000 with funds available in the capital fund and the jail fund.
9 seconds.
Motion and support. Is there any further discussion? Roll call.
Nye,
Yes.
Roloff,
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
you're not,
Yes.
motion carried.
Item K, consider approving the purchase of a canine animal for the sheriff's office.
I'd like to make a motion the Board of Commissioners authorizes the purchase of one police canine dual-purpose dog from Fresh Coast Canine LLL in the amount of $17,000 with funds available from the canine fund.
A second.
My question is, who's going to be the handler?
Deputy Ryan Dumont will be the handler. He is going to take possession of Omar. That is the dog's name, on December 21st. And we'll begin training both down in Ludington in person for 3 weeks, and then up here. The training facility is in Ludington, where the dog is training right now. He is already down there and he's already working on his training. And then he will come here and he will do field work in Benzie County, where he will be working along with the trainer, and that is part of the bid process.
What's the breed of this dog?
This is a mix. It is a German Shepherd Malinois mix that happens because they try to breed out the Shepherd physical disabilities with hips by mixing them with another dog, because they very much have a tendency to have bad hips. There is a warranty with this dog as far as genetic effects for 2 years. It just occurred up Grand Traverse County, where one of their new dogs, after 15 months, had a bad hip and no longer be in service, and that this company replaced that dog for free because it was a genetic.
Out of curiosity, at what age do you get the dog?
I think 6 months is what the age that the company purchased them at. And I think it was younger than that, actually. 3 months, he'll be just under a year by the time he's done with his training.
So the purchase price includes 6 months of training?
Yes,
correct? Okay.
actually, over the period of 2 years, it also is some continuing education training up to 2 weeks a year. And certification of the handler, making sure that the handler and the dog are doing what they're supposed to from this company.
Any other discussion? Roll call.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
motion carried.
Item L, consider approving the annual services agreement for, oh, we already got
did
that one. Sorry, didn't have it marked off.
Better.
M, consider authorizing 2% grant application regarding emergency medical dispatching.
So you'll recall at your last meeting, we did approve dispatch moving forward with emergency medical dispatching. You did approve that though with the under the assumption that we were going to apply for a 2% grant to help support that cost. And so what is in front of you is a grant application to the 2% tribal allocation to help support that cost to implement emergency medical dispatching. We've already received a grant from the MMRMA, and so this would be a grant to help support that endeavor.
I'm gonna make the motion that the Board of Commissioner approves the grant application for tribal council allocation of 2% funding on behalf of the Central Dispatch for emergency medical dispatching and authorizes the chair to sign. Support.
Motion and support. Is there further discussion? Roll call.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki.
Yes.
Motion carried.
Corey. All set? All right,
It's just available if you have a question.
yeah. Item N, consider approving land use agreement with Crystal Mountain for small storage barn.
This is very housekeeping in nature, as part of just doing business and cleaning up records and those sort of things from the past. We have a small storage, space at Crystal Mountain, primarily used for CERT. And there's no formal agreement on the books as to that storage space. So this agreement is very boilerplate in the sense it just memorializes that relationship for the use of that storage. Rebecca can go into detail about what's there and how long and that sort of thing if you guys do have questions. It's very boilerplate in housekeeping.
I'd make a motion that the Board of Commissioners authorizes the land use agreement with Crystal Mountain for the storage purposes, subject to approval as to its form by legal counsel.
Oh, and authorizes the chair to sign.
Yes, of
I
course.
forgot that piece. Dang it.
Of course I meant that.
Gotta get listening.
Support.
Thank you. Motion and support, either discussion. Roll call.
Janat,
Yes.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
motion carried. No question.
No comment?
Thank you.
Thank you. Item O, consider accepting proposal for design and architectural for parole probation expansion.
So one of these days, I'm hoping to get to double A and double B. That'd be cool.
No,
So I'm gonna jump right into this, because I couldn't be more excited about this being done.
I figured you would be.
That the Board of Commissioners accepts a proposal from Environment Architects for the Benzie County Parole Probation Admin Office expansion, including construction management services in the not to exceed amount of $36,925 with funds available in the capital and ARPA funds.
no, we've talked about this for a long time.
Yeah.
Pardon me?
Years.
Seconding.
Okay,
He
thank you.
said 2018.
No, no, it was longer than that.
Was it?
Yeah, it was 2008. Yeah,
It was 2000.
it was 2008. It's another one of those things that you as Benzie County have been talking about for a long, long time. We're trying to just check off that list. Is what we're doing. So once the list is done, I don't know.
Gary, what you're remembering is when we finally authorized that capital plan or the space planning.
Mhm.
That's when we tried to get it on the radar. We've been talking about it ever since.
Well, initially, they wanted to put a bathroom in probation parole.
Yes.
And
Yeah.
the water and sewer comes out of the bathroom down on the first floor and runs right down the middle of the hallway. So they would have had to literally undermine the floor in probation and parole to get out to there. And that's what was the big hiccup.
Mhm.
Okay.
So
Are they gonna end up with a restroom there, Bob?
they don't want one now.
No, they don't need one.
I guess it's worth waiting, right?
It was at this point.
Yeah, right.
So there is a motion and support. Is there any further discussion? Roll call.
Knight,
Yes.
Roloffs,
Yep.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes.
Janat,
Yes.
motion carried.
So Katie alluded to this, but I'm gonna read this statement. The Board of Commissioners had recognized a deficiency in the process of obtaining bids and proposals for Benzie County projects. And because of this, the Building and Grounds Committee is looking over the policy and procedure to ensure improvements to the process are made. On behalf of the county, we apologize to any of those affected by the identified flaws in this process.
That was real wordy.
Thank you, Chair.
I appreciate that.
Item P, consider approving signage for Benzie County Government Center campus.
In your packet, you will see various communications related to signage on our campus. This has went to the buildings and grounds a couple of times. It's also been on our capital plan for a couple of years now. We've identified that not only is the sign outside of the governmental center really in need of replacement, we've also identified that a lot of people in the community, once they get onto our campus, they don't really know where they're going. And so Paula's shaking her head. They will come into our building. I need the sheriff's office. I need animal control. And so to help with that and to help the community kind of find their way, part of this package proposal is not only a replacement sign for the governmental center as well as animal control. If you walk up there, it's very dented and rusty. It would also add wayfinding signage around the campus, and it would also identify the sheriff's office. When the sheriff's office was built, there was no signage actually put on the building to identify the building like there is here. It says government center. And so the sheriff was like, can we get that sign too? And so part of this package proposal is also steel letters that would identify that building in addition to the wayfinding and the replacement signs for the Gov Center and animal control. Those signs will have the same look and feel as the current sheriff's office sign, because that sign is a great sign that's pretty new compared to the others. And so all the signs will have the same look and feel. So when you come to the campus, there's a sense of place.
One of the extensive conversations at Building and Grounds was whether the government sign should be lit. And at the end of the day, we decided it's not needed 24 hours a day. And so as long as it's uniform and looks a lot, very similar to the sheriff's sign, it needs to be lit. And we landed on this one did not.
Correct. So the sheriff's office really is a 24-hour safe haven. If somebody needed something at any time, they could go to the sheriff's office. Nobody's coming to this building. And so in essence, to save the money, because it's quite a few $1,000s, we landed on not lighting this sign.
So the recommendation, with the exception of one sign, is the non-lit signs.
None of the signs would be lit. They'd all be reflective. The sheriff's office isn't being touched. It's already backlit.
Oh.
These are additions to have the same look and feel as the sheriff's office. Theirs is already lit.
So then the proposal is for the non-lit signs.
Correct. So non-lit, just reflective for everything else.
Okay, and just for the record, you and I had the conversation. They will dispose of the current signs, even though it doesn't say that.
That's my understanding, is they'll take away the crap that's there.
Yes, they will. I reached out to them. They will take away the signs and dispose of them for a disposing. So,
Yeah, they
What are they
have.
charging?
it wasn't very much. I can look in my emails to tell you exactly.
Less than $1,000?
Yes.
Yes, yeah. Because of the materials, there's a fee. They can't just throw it in a garbage.
So I'm gonna make the motion, but Tammy, pay attention, okay?
Okay. Yeah, okay.
The Board of Commissioners approves a quote from Pro Image with funds available in the Capital Fund and American Rescue Fund, and authorizes administration office to sign the non-lit proposal. That's the way to say it. I just want to be clear about which one we're approving, that's all.
Motion by Art, supported by Gary. I have a couple of comments. So is there lit signs out there out in front right now?
No.
No,
Nothing is lit.
just the sheriff's office is lit.
Okay.
It will also be placed closer to the road more uniformly with the sheriff's office sign. Right now it's set back on an angle, so you can only see it
From
coming
one direction.
Our government
Right.
sign out front.
Government Center only has letters on the far side.
Correct. So this
Nothing on
one,
this side.
this one will be double sided,
Right.
closer to the road and placed more perpendicular, so you can see it coming from either direction.
And aesthetically, having them all uniform and done, I think that's important for us as Benzie County. We need to have a look fresh, new,
Correct. Yes.
available.
Yes.
I'm gonna acknowledge the fact that out of the 3 bids, Pro Image was the only sign company that actually provided pictures of the signs.
With a silhouette.
With the silhouette. to give you,
Yes, I saw that silhouette.
Great feature.
Well, because we're still in discussion on that, I do want to point out, I think it requires some explanation for the community that Pro Image is 49% higher than Simplicity. You want to explain that?
Sure. So Simplicity actually had fewer signs. When we after the first buildings and grounds meeting, we took a walking field trip and walked around and really talked about the placement of the signs and additional signs and such. And so we had reached back out, Rose did, reached back out to these 3 companies and said, hey, here's some tweaks to what we were originally planning. We want these additional signs. Simplicity didn't give us an additional proposal. So their proposal is actually for fewer signs than the other 2 are. Also, their signage is a bit smaller than Pro Image, and we really wanted those bigger signs so that they're much more user friendly for the community.
Thank you.
Good question.
Any other discussion? Roll call.
Nye,
Yes.
Roloffs.
Yes.
Sauer,
Yes.
Worsakki,
Yes.
Cunningham,
Yes,
Janat,
Yes.
motion carried.
Item Q. First time I've ever said item Q on our agenda.
I'm getting to AA one of these days.
All
No,
right.
you're not.
Uh-huh.
I hope not.
Consider adopting a resolution to accept $400,000 Spark grant funding in terms for the Betsy Valley Trail and paving Phase 1 and approving additional Sparks grant for paving Betsy Valley Trail Phase 2 and 3.
So you'll recall a couple of months ago, this board took action to authorize a grant application for a Spark grant to pave a portion of the Betsy Valley Trail to Case Road. We were awarded that grant in the amount of $400,000. And so part of that motion is to accept those grant funds and adopt that resolution. That resolution then adopts the terms and the agreement related to that grant through the state. The Spark grant, as you may know, is actually state ARPA dollars. And so we are held to that timeline that the feds have put in place for ARPA dollars. So the work has to be done by 2026. We have to be within contract with any agency by the end of 2024. So that's the first part of this. The other part of this is then to authorize additional grant applications. The group feels confident that we may be able to receive additional grant funding to pave and do other portions of that phase project. You'll recall originally when they came with one big project and everybody got a little sticker shocked because it was millions of dollars to go do this whole project. And so they went back to the drawing board and they approached it in a phased approach. And that's why this first phase was $400,000. And then there was 2 additional phases to address culverts and such under the trail and finish paving the trail. They would like to move forward with additional grant applications to try to cover some of those other elements within the Phase 2 and the Phase 3 of that project. So hopefully we can proceed with the entire project. The Betsy Valley Trail Committee and Gary can go a little further into this. They've talked about this because as you know, the Friends of Betsy Valley Trail, we have a lot of friends in Benzie. They're really part of this and they're assisting with the grant administration and such for this project, though it's very scripted by the state of Michigan as to what we do. But they're really assisting with that grant administration piece of this.
Concerned at the beginning about this being reimbursable. and the county having to front money.
Mm-hmm.
That was the big concern. So
Mm-hmm.
I will address some of that if you want. First of all, that should say raise grant instead of spark at the second one. That's the more expensive one. It comes through the feds. I don't know how this changed or why this changed, but they're talking about giving us half of it up front before we start.
Yes.
And if we go to this stretch to Case Road and we have left over, we can go farther. So it's just have to plan for it. So I thought that was super. And it even follows the raise grant. The reason we're asking to do the raise grant is because we already have the paperwork in the process, but the raise grant would also allow us half up front, which that's the big one that would take it the rest of the way to Thompsonville. So, we don't have to accept it if things are changed, but right now it sounds pretty good. And I guess Katie's on board to help, which is the huge part. So,
Yeah, Lara or Laura, she's been great to work with. And so her and I have been working on this in the back end. Rose and I sat through a really nice onboarding session with the state of Michigan to talk about these grants. And we talked about the upfronting some of the funding specifically, as well as you can amend the project scope. So if there's overages, leftover money, we can amend the project scope that was submitted with the original application to include additional footage or what have you. So there is some of that flexibility, which is a positive. And I missed the raise grant piece of it.
oh, that's fine. It's just that I was shocked. They said they would upfront it before. They were talking about us upfronting $4 million, and I know that wouldn't go over too well. So.
Yeah, it's case by case is how the state put it to Rose and I. It's case by case. If we submit a good request for that funding, they will consider that and appropriate as they feel necessary. And so we feel that we have a pretty good case for the simple fact of we're a small community. We don't have deep pockets like large communities, as well as this trail. The state has a lot of stake in that trail. And what happens on that trail and such. So
We're all on board. So I'll make the motion, but I'm not going to read it. Oh gosh, I can try.
Thank you.
Yeah.
Do you want me to read it?
Yeah, would you? That'd be nice.
That the Board of Commissioners adopts the resolution accepting Michigan Department of Natural Resources Spark Grant terms, project number ARPA 0997, resolution 2314. Authorizing the Spark Grant application for reimbursement funding for the paving of the Betsy Valley Trail from Beulah to Case Road, and authorizes further that Michigan Spark Grant applications and federal Raise Grant applications be approved for phases 2 and 3 of the paving project, and that the chair and county administrator be authorized to sign the related site control and grant application documents. I added that in.
Second.
Added the raise, yeah.
Yes.
Longest one of the day.
I'm sorry.
Motion and support. Any further discussion? Roll call, please.
Roloffs.
Yes.
Bauer,
Yes.
Worsakki.
Yes.
Cunningham,
Yes.
Janat,
Yes.
Nye,
Yes.
motion approved.
Thank you. We'll move on to commissioner reports. Starting with October 24th, which was a board meeting in the morning. And I had the EMS, animal control ad hoc later in the day. And communication talking about, what's the status of Station 3 and animal control. So at this point, we're not really in limbo, but we're still looking at the possibility of moving animal control. But that's just conversation right now. So we'll know more a little bit later. I did do a drive-by Station 2 to look at the possible areas that I'm sorry, Evan. How soon I forget. Seems like that's in the movie.
Top Gun.
About the possibilities of animal control being at Station 2. They have around 5 acres, just short of 5 acres, so it is possible. But that's just conversation. So So we'll see, the conversation with Station 3. Well, coming to animal control, so I think we get through what we have on our plate right now before we start talking about that one. 25th Domestic Violence Task Force. This does not meet. It meets quarterly. Like I said before, I'm usually very careful about what I comment on in that meeting. There's some delicate stuff, but one of the ongoing issues is child placement, up to 17 years old. And these foster homes or detention centers. And we all heard the cost of what that is today. So there are local kids that have to go to these places periodically, and at $290 or whatever a day, 30 days, do the math. I mean, that's a big chunk of money. So, but if these kids need help, we need to get them the help they need, and hopefully slow down, what that sickness is. I met with all you guys for the Headley at 5:30 that following Monday. It was a blast. On the 6th, Building and Grounds, I think we touched on all of that. Agenda review. 911 was canceled. Veterans Day, thank you all that supported and attended Veterans Day. A little cool that day. We had Colonel Michael Clark. Most of you know Mike's a 1975 graduate of Benzie Central, West Point cadet, and then moved on to a total of 36 years in the Army, and then another extended, I think he had a total of 39. And his wife was there, and he made a couple of comments, but they moved a lot over that time period. He had a total of 23 times that they moved. The 23rd was moving back home to Benzie County. So that's a lot. I got permission from a couple of local families, Gary Watterson and his wife, and Nancy Fredericks. And her husband, Tim, or John Plumstead's mom and stepdad. I did have a conversation with John about representing him as a veteran and his accomplishments, as well as talked about Greg Watterson. Greg was a 1998 graduate of Benzie Central, a Naval Academy attendee. Both them gentlemen came out as officers. Greg resigned his commission after 9 years and went to work for the federal government and does amazing different stuff. It was impressive to be able to get the bios on both these guys. They both provided me decent information, and John Plumstead as well. 2004 graduate of Benzie Central. West Point cadets were at that graduation ceremony as well. I forgot to get from him who the congressman that endorsed him, but Mike Clark's was Guy Vanderjack at that time. John had a litany of accomplishments. One of his proudest was walking on the Army football team. He did not dress for outside away games, but he was on the team from his second year through his final. His final year was as the Army defensive team captain, middle linebacker. There he went on to college at the same time. He was stationed many places, retired after 16 years plus 4 years of college, which gave him 20 as a major in the United States Army. Him and his family live in Florida now, and he works for an investment real estate firm. If 4 boys, 11 and less and less and less. So 4, 11 and under. Of course, he's married to Danielle Moss, Peter Moss Sr.'s daughter. Pardon me?
Granddaughter.
Okay. Correct. I was talking about Peter Junior. So. Pete and Carmen. Yeah, that's the one. And she's from Leelanau County. So. Veterans Affairs yesterday, we talked a little bit about this past Saturday and have just a business as usual until we get over the next hump and move on. So I will lend the field to Commissioner Janat, if you have any comments you want to make on your.
I do, because I've been encouraged to. So at Lake Township, they discussed a proposal regarding Headley reset. There was several good questions. There's potential for action at their December 7th meeting. The township continues to recruit for a zoning ordinance enforcement officer. The Michigan Association of Counties, I sit on the Finance and Governance Committee. Legislation has passed now regarding solar energy. The language gives oversight of this ordinance to the state, basically. But amendments were introduced and passed that would allow units of government with ordinances in place to be the approving body if they adhere to the state's ordinances. Sorry, I thought I was gonna do that with a straight face. The effective date would be 1 year from the date of the governor signing the bill, which I'm sure will happen soon. And I have been in contact with all of our elected officials regarding those amendments and expressing my displeasure on how that passed. In the townships that I represent feel the same way. I've been in contact with elected officials stating my strong support for revenue sharing. Apparently there's a group organized under the name First Amendment Auditors. Tammy, this is more for you, that are contacting counties to determine their compliance to the Constitution. I doubt you've had a contact yet, but they're apparently going around the state doing that on site, being disruptive.
Okay.
Mhm.
The president of the law firm Foster, Swift, Collins and Smith gave a presentation on FOIA. There was really nothing new to learn, but it was a good refresher. Platte Township, modest turnout for the election. Approximately 50% of the votes cast were in mail-in, and I think that's probably going to be a trend. Many of you saw that probably in your own communities. The next board meeting's not until January, and they plan to have the Headley resolution on the agenda at that time. With respect to Elmira Township, there was an advisory or ad hoc committee yet to be decided to determine the direction of fire and EMS. I guess Tom's not here. And they also will potentially be taking action on Headley at their December 11th meeting. I'm working with Housing North to identify a resource to focus on housing needs in Benzie and Leelanau counties. I have suggested that we discuss this at future BOC meetings, and I think about a possible tax abatement at the county level. And the feedback I got is it could potentially be in December. I had a few contacts regarding Headley reset by the public. Most of them simply were seeking additional information. I met with Representative Coffea yesterday, both in and outside of her scheduled meeting. Talked about several House bills that were discussed, that were going through and that did go through. I shared that a committee she has shared with me that a committee has been set to discuss composition for kinship care, and I think we talked about that earlier. And I've been raising this issue for several months. I'd open it up to questions if there is any. That's it.
Karen.
I was going to just highlight mine's written report, so I'm going to do a
Thank you.
hybrid.
Yep.
And just highlight a couple of the things I
Thank you.
attended. You're welcome. I attended the airport authority meeting and requested from Dick Bayer an update since that was in discussion here at the board. And he sent me a list of 23 things and how the airport has improved. So I highlighted some of those in my report and put them there for you. community impact and benefits, how money that's spent in the county, and also that they have received their general license. And he was able to explain to me the additional funding they get through that because they have been moved to that with Corey and the board that are there right now. So I do have that full list and I can email it to you all if you would like it. This is the highlight on that. I went to Lake Township. He always goes first, so he's got main points, and I did have discussion with a few more people within the week after that. And like Art said, they were just seeking more information and understanding. At the township meeting, which was wonderful, I thought, and we had good representation here. The feedback that I received back from people was their biggest concerns were, it was said this way, trust in the commissioners to use the money as they had voted it in millages, if it moves to general fund. So they used the word trust, but being elected, I just stopped there. That was the way they described it. Okay. So, but that is a concern, and the education, and the booklet was very, very well received for kind of giving a synopsis or a summary of the 3-ring binder, which I did read through a few times, and Katie told me, no, you don't need to include that note. And I said, okay, I just need the bullet point also, because apparently I was reading too much. I did go to the MAC, Michigan Association of Counties Environmental Regulatory Committee yesterday. Our liaison is Ms. Fada. She informed us on the legislative update, just like Art said, that the Clean Energy Renewable passed and juvenile justice passed, which I think most of us already knew that. Our speaker was Jennifer Dixon, who was from Eagle, and they mentioned that air quality, we have made great strides here in Michigan in air quality. It doesn't mean we're there yet, but we've made great strides. So I asked, because I know we have the septic bill coming up, are there parallels that they could use success in how they've educated, monitored, reinforced, that could be not reinvented, but be used with water also? And so that is going to be for future discussion as a topic in this multi-county group. She is also going to work on a summary that she will share with our environmental group on the clean air renewable energy that was passed. So she's going to look for trying to get that into bullet points for us, so we can bring that back to the counties and share. And as soon as we get that, I will bring it back to the board, email it to probably chair and vice chair, and then also Katie. So, and you can decide what you like. Okay.
Yeah.
And the last thing I did, and again, it kind of pairs up with something that Art mentioned. I attended a special public hearing at Frankfurt for the final resolutions for 2 residential housing district and attainable housing district. The way it was presented was that Frankfurt had a public hearing to discuss the creation of attainable housing district, and these districts allow the city to partner with a private sector for the creation of sustainable workforce housing. And so it's information. I just went to it for my own education, but when that entity, Frankfurt in this case, is looking for tax benefits to encourage different ways of housing, and they're going to section off as a trial, possibly, to see in this area for rentals or buying in this attainable housing. So I thought that was a good topic. We're not there yet, but that's what the hearing was about. Unless there are other questions, those were the three areas I was going to highlight.
Thank you. Rhonda?
Sure, thank you. I attended agenda review. I attended the Benzie Leland District Health Department. We entered into a closed session to confer with the Health Department Legal Counsel. Eric Johnston reported that overall the number of requests for land use services, including final inspections during fiscal year 23, are up 8.56% from fiscal year 22. The Health Department will be changing their insurance agent from HUB to Advantage Benefits, which is what the county uses. And the Health Department will be closed December 1st for their annual staff day. I attended the Headley Reset Town Hall with everyone here. Central Wellness Executive Committee met on the 31st. We had a recipient rights issue, which we considered at length, a couple hours, which culminated with a letter drafted to the state requesting more information. November 6th, I was at the Village of Benzonia. They revised their Village of Benzonia zoning ordinance, and that was adopted. The new zoning ordinance will be in an electronically tabbed format as required by redevelopment ready community best practices. That's huge. To be able to go to a site and put in a word where you want to find information about their zoning and it pull up where you need to go.
That's awesome.
You know, a lot of our smaller municipalities, if you want to find topics that were discussed, you better be ready to sit down and go through their minute books for a long time. So this electronically tabbed is a big deal. Their Sparks grant was not awarded this round for the Academy Park ice rink. And again, we're talking about the Village of Benzonia. Their garage project is almost complete, which included a larger door opening, roof, heater, and insulation. We've discussed the Building and Grounds Committee. The only thing I would add is that there was a discussion about parking lot lighting, sidewalks, and concrete upgrades, and those likely will be delayed until the spring. I attended Benzonia Township meeting. The supervisor acknowledged the passing of trustee Jim Sheets with gratitude for his years of service. The vacant trustee position must be filled within 45 days, and any candidate must be 18 years of age, a U.S. citizen, and a township resident for 30 days. The assistant zoning administrator, Mary Pitcher, was appointed as township blight officer, and the Headley Reset resolution was approved by Benzonia Township. I also attended the Joint Court Public Defender interview. There were 2 qualified candidates. We interviewed them in a round-robin format. Jane Johnson was selected with the overall sentiment that both candidates interviewed very well. I attended the Central Wellness Board meeting. It was reported that funding for CCBHCs, which is Certified Community Behavioral Health Clinics, has gone from 100 million to 380 million for 30 plus sites in Michigan, serving 6,500 people. It was reported that 70% of those being served were found to be at a level where they should have been served by the CMH anyway. Our CMH serves 1,400 people, and 200 of those people are served by our opioid health home and our behavioral health home, and benefit from other services such as Catholic Human Services. There was a report presented that shows that recidivism in hospitals is 20% better with behavioral health homes than with CCBHCs. We were also given a presentation and a discussion regarding alternative outpatient treatment and the criteria of court-ordered treatment that was supported by Michigan compiled laws PA 176 of 2023. I attended a Natural River Zoning Appeals meeting with Commissioner Sauer. It was noted at the beginning of that meeting that only 4 of the 7 voting members were present, and the applicants were not in attendance. All 4 members needed to agree for a motion to pass. If the request was considered and denied, the applicants could come back at a later date, but not with the same request. It was decided to move forward with the consideration. They were requesting an 8-foot high, 100-foot long chain link fence to the river's edge to prevent trespassing. There was a lengthy discussion of options and possible precedents. 7 standard review questions were deliberated to guide their decision, and ultimately the request was denied unanimously. Last night, I attended the Benzie Central School Board meeting. The bus garage bids will be open November 30th. Their fall 2023 general collection update results of count day showed student count down considerably from last year. Crystal Lake Community Mentors are accepting volunteers to mentor students at Homestead Hills Elementary School. There was a 2022-23 audit review presentation by Julie Burks of Dennis, Gartland and Neargarth. The school's net position was up 4.1 million. There was a significant finding that transactions had not been recorded because bank reconciliations were not done in a timely manner. And there was a non-compliance for excess fund balance in food service. There is no penalty for that, just an action plan will be required to spend down that fund. And there was an approval to list Crystal Lake property that was pulled from the agenda. And later in the meeting, it was discussed that the Benzie Wellness and Aquatic Center was going to be given 2 weeks to finalize an agreement. Once in place, a 90-day inspection period would be agreed to. If this agreement does not culminate in a closed sale, the property will be listed for sale. And then finally, I attended the Veterans Memorial Service that Bob did a great job at, and it was an honor to be there.
Appreciate you being there.
All I have.
Rhonda, could I have the tab information and you can give it to me afterwards for the permits, how to find?
For the Benzonia Village.
Yep.
Yep, it'll be on their zoning, it'll be on the
Under
Village of
zoning.
Benzonia website.
Okay,
They will have their zoning ordinance, it'll be electronically tabbed, so you can search what you need. It'll be
Thank you.
published first, once that time frame is done,
okay,
then it'll be put online.
all right, thank you.
Commissioner Warsick.
Rhonda,
Yep.
if I could, I have a question for Rhonda. The bus garage at the school, has there ever been a discussion about cooperating with Benzie Road Commission and
We did, we had that discussion, and actually the administrator facilitated a conversation with the schools, the road commission. Who else was at that meeting?
Benzie Bus.
Benzie Bus was at that meeting, because I've heard it said, I believe,
Multiple times.
talked about why aren't these services consolidated with one maintenance spot? And I think that the consensus was that it just was not a feasible concept.
Yep, we all sat down, both schools. And yeah, the consensus is there already are a lot of partnerships happening between the schools and Benzie Bus and such and the road commission. That just nobody thinks about, I guess. But as far as having like a central location, the consensus of the group was that it just wouldn't work.
is it your opinion that that's a legitimate response?
Oh yeah, I'd have to go back through my notes, but we had a quite in-depth conversation about it, and I don't think it would work.
Okay.
But there are more partnerships happening between those agencies than most of us realize. So it is happening to some level, but the total level that I think the board wanted us to explore just isn't possible.
Well, as long as they're having the conversation and as long as a neutral party, the county, is in that conversation, I'm satisfied.
Yep.
All righty. Evan.
Excuse me, the EMS, animal control ad hoc, which you so eloquently covered. I was at that. The Headley as well, and then the only other one I had was the Inland Township meeting last night. One of the trustees was sick and was not there, and then there was a medical issue with another board member, so it was kind of a discombobulated meeting, but in reference to the Headley discussion, they ended up tabling that, so they'd have more time with the other board members, and then also, excuse me, trustee Sherry Polisi tendered her resignation as a trustee just for some medical issues, so there'll be an open trustee position on the Inland Township Board.
Don't look at me.
Well, I'm looking at you because you're just about next. So Gary.
You can talk your husband into it. So
Oh, no.
great job for him.
Nope.
She'll tell you he doesn't have time.
Yeah.
It was gonna be super.
Doesn't have the temper.
Whatever. Ron, the Hill, talked about the health department. Last we have heard on the septic ordinance, it won't be even coming forward till spring at the
Good.
quickest. So hopefully things will change. They have invited actually what I consider some of the experts, health departments to help. I don't know where it'll go, but who knows? Road Commission, I attended 2 different meetings. One of them, Benzonia Township approached on doing Cedar Street, which is only 855 feet, but there's a lot of issues there. And since then, we've had the last meeting, and the engineering cost alone on Cedar Street is right now at $56,000. So all costs would have to be incurred by Benzonia Township. So I don't know if that's even feasible. We'll find out once they get the good news. They had a walkthrough for the demo of Platt School, well attended. Ask about reusing some of that stuff, and because of some issues in there, they may not be able to reuse any of it. It's definitely coming down, so. They had quite a gamut of proposed prices. They'll open the bids here shortly, I believe. But we should know shortly in the end of December, and I don't know when they'll be able to do it. Probably depends on weather and so on and so forth. A lot of it was concern over asbestos being in different things and everything. So anyway, I think young man there, Troy, is doing an excellent job and moving forward. Pretty sharp young guy, so I think it's well under control. So I'm happy to hear that. They're happy to see that. Maples, we are having a meeting this week too. One of the goals by their board was that they would be profitable in 2024. And to reach that goal, they have to eliminate, hopefully, the contract employees. If I understood some of the stuff I just read, that could even happen in December. So when the contracts are over on some, they have been able to hire quite a few people. They were at 75 at that point in time, and they had hired 6 new hires. And since then, they're at 78, I believe. So just about max. And most of the admits are from Benzie County, so that's a plus. The Mac Ag and Tourism, I kind of wanted to talk about that a little bit. They talked to Larissa Draves, and she spoke about the CVB. Talked about Public Act 268 and Act 59. The counties collect a bed tax, and then those entities vote on, I think we're with Traverse City, Grand Traverse County, and the money is used to promote that. And of course, what immediately got brought up was the extra cost for public safety between police, especially in the summer when all of a sudden our population doubles or whatever. And it's worse in the UP because they don't have any extra funding. Well, she kind of brought up a real valid point that it's not just the hotel motel business. It has to involve all the folks that are involved in the tourist business, and including short-term rental, which I think in the future that's going to be where they're going to go. I don't know if it's something that it would fly very well as taxing these things, but if this is an additional cost, it always reminds me of the money we use for the phones. And we can only use the phones assigned to Benzie County. Well, how many phones even in this room are assigned to Benzie County? Just saying. So we'll see where that goes. Headley reset, I thought that went well. My only thing is there a huge rush to get these resolutions? Is that something that can be done early winter, February? I'm telling folks, don't hurry, take your time, go through it. You know, if you want to ask me questions, feel free, or anybody else, but I'm looking at the rest of you. Is there a big hurry to get it done before February or March?
We just want to make sure it can be on the ballot, whatever that time.
Well, that depends on how these folks react.
Right. Yeah, so that would be really the only timing. If the consensus is to move forward, this board needs to decide if they want to put it on the August ballot or the November ballot. I would recommend both if we need to. So that would be it. I believe typically for August election, there's a May-ish deadline
I
for
remember if it's
proposals.
April or May, but.
Seems
put
like
it in there.
April.
So,
Yeah.
so it would be, that would be really the only timeline.
The observation I would make is we have to have that tax advisory committee that's gonna make a recommendation. That's part of the ballot language.
Correct.
So they'd have to be identified and then they have to come together. They might want to meet multiple times to make a recommendation. So we don't want to push it out too far. They go to February, you're talking November, December, January, February. Quite frankly, they're probably looking at a no answer if they got to go that far out, Gary. The townships that I'm working with, I have not pressed them, but I've asked them to at least make a decision in their January meeting.
Okay, Blaine Township only had three board members there at the last one. It was enough to have a meeting, but they didn't want to make that decision until the entire board's there, so.
I agree.
I know Weldon's gonna hit me up tonight. Most likely, Gilmore. Went to the workers' comp thing and luckily I brought back the check. Katie took it, so I haven't seen it since. So we got $64,000 back in the dividend, and Benzie Bus got 28, almost 29. We had discussed the First Amendment thing that Art brought up, and I gave Katie AJ Hale's phone number, and he does presentations. He works through the workers' comp or comp one there, and would be willing to come in here. He would like a 4-hour block to train employees and what not to do and what to do if this approach comes. And Katie told me it already happened here.
Twice.
So I think the training is something I would be very much inclined to do, just to help employees to know what's your safest bet to do with this, because some of it can get pretty intense if they want to. So Katie's got the number. You guys agree, then make the call and AJ will come up here. And buildings and grounds, that one, the Valley Trail, Thunder, what else I got in here? I got all kinds of junk. And thanks again, Bob, that and your board for the Veterans Affairs. That was a nice ceremony. Wasn't snowing. Granddaughters did get cold, but they did enjoy it. So
It was a privilege, Gary. Thank
yeah,
you.
it's always good, and I appreciate it. Oh, I know, Village of Thompsonville. I had told you before that Mary Wixom had resigned, but she just got reinstated. And we're still looking for one or two folks to serve on as council members. If I understand them correctly, they're looking for an ambulance in Thompsonville. Tom's not in here, so I guess if you're looking for a used ambulance, there's not much out there that's got anything but a lot of miles. They've had, I believe, 7 new hookups for the water system, so they had 5 new houses. I believe in what they call Easy Street, and I don't know if that's small, whatever, but that's 5 new residents and 2 Habitat homes that went online. So Eville's growing, so that's always good. That's all I got. Thanks.
Questions for Gary?
Gary, just an update. We're going back to the CVB. I was one of the founding members when it was in Benzie County many, many years ago, 20 years ago. In order to be required to collect that surcharge or that assessment, 10 units or more. So for a short-term rental, they can, as it's written today, the statute's written today, they cannot enforce that.
I think they were looking at the short-term rental part is to help pay for the public safety issue.
Well, I get that. I'm just telling you, under the
Yeah.
CBB, the statute, the only time they can enforce collection is 10 units or greater.
If I understand this right, the tax is collected through the county and paid to the CVB?
Well, they're not collected through the county.
It's not collected.
No, the monies are collected on site from the lodging owner.
Okay.
Those monies then typically go to an accountant or an auditor of their choice. And then those monies end up back at the CVB.
He said that they were audited by the state.
That's true, every year.
So there is oversight, government oversight, some sort. There's a lot of these folks on that committee think that there should be a commissioner on there. You know,
But there are communities that have, the county assesses a tax for public safety purposes. Because to your point already, they get leveraged up, but we have no additional money coming in. It's complicated, and I think someday we ought to discuss it, because it wouldn't be on the backs of our residents. It would be on the backs of the visitor.
yeah, I think it's worth the discussion. Thank you.
Thank you. Katie?
Just a few things for me, on the homepage of our website. If you scroll below the search bar and the agendas and minutes under latest news, I have placed everything I have to date regarding Headley Reset on there. The presentations that were passed out on October 30th and such. So it's right there on the homepage. So for folks, just point them to the website, and we'll continuously add information there as we get it all together. So it's right there for people. I just want to give a reminder to everybody that after today's meeting, there's 2 meetings left in 2023. So we've sped through 2023 pretty fast. So I just want to get it rolling in your minds that there's 2 meetings left. If there's things that you want to see on the agenda, let us know. That goes for staff as well. And then to also start thinking about your committee appointments, because in January, those are, redetermined. So I just want to give you that reminder. We have 2 meetings left of the year. The Broadband Digital Equity Task Force, we have started meeting. And so we're at a point right now, we're just talking amongst the group of, I believe there was 9 of us there at the first or the second meeting, just talking about what Benzie County really needs in the broadband digital equity spectrum or compass. So talking about, what are the true needs of our community when it comes to broadband and how that's utilized. So going through that, we're looking at spring, mid-spring, as far as having deliverables to the Board of Commissioners for implementation of different things for broadband and digital equity, whether that's grant applications or such. I am having conversations with Elmira Township as well, just specifically talking about EMS. So there'll be more to come on that. And then just a quick, the Grace Fest will be December 8th. So wear your stretchy pants.
Thank you.
I'll be in them.
That's all I have.
Thanks, Katie.
Not because of that.
Katie, has the L 4029s, have they gone out yet to the townships?
I don't believe so.
Okay.
Yeah.
Elmira's Township Treasurer stopped me and would like to know the disposition of when she's gonna get them. In her mind, she should have them already, so.
I believe that the actual deadline is November 30th, like the true deadline by the state. We have to adopt an amended L 4029 for the simple, or not adopt, but we have to present them with an amended one because of the road commission. So we didn't have the road commission on initially because we didn't want to assume that the community was going to pass that millage. So it does have to be amended to add the road commission on there, and then it'll go to the taxing agencies.
Did somebody reach out to Mandy and let her know?
Brianne?
Mandy,
Equalization Department would be glad to get a hold of her.
sure.
Yeah, but
Brianne.
Mandy is with,
Mandy is the treasurer at Elmira Township.
okay. Yep.
Thank you.
And administration is working on our county at a glance document, right? The entities that I visit really appreciate that
Yep.
document.
So that is actually about done. We were waiting on the auditor for a couple of numbers. I submitted yesterday to the auditor the final steps for them to give me that draft report. So once I have that draft report, we'll have those numbers to finalize the budget at a glance. And then I'll sign off on that draft report, and that'll be our county incentive plan reporting as well to the state of Michigan. So that should be done here pretty soon. It's essentially done. We are just waiting on those few figures.
Thank you. So. Unfinished business, new business. Brings us to our last public comment. Anybody?
I want to say something.
Okay.
Just wanted to give you an update. The election, we had a few hiccups, went pretty good, but we got through it. I want to give a shout out to Greg and Rebecca and for being here because we thought we were going to have some issues
Right.
and they helped us out.
Thank you.
A shout out for Katie for helping me with the one. But we are now moving on. I heard legislation is going to be adjourning today is what I thought I'd heard.
Seen it
So
done.
that means all those bills that were signed in July will
Carpe
take
diem.
effect 91 days after they adjourn. So we're getting into the 9-day early voting process. I have a election source coming in tomorrow to demonstrate the new tabulators and how we shut them off for the 9-day early voting. They'll also show us the old tabulators. I have some clerks from Manistee County that are also coming. Oh, sorry. No, I'll go fast. But I'm still meeting with the clerks every couple of weeks just to go anything new that we've heard.
Right.
On 9-day, send any questions to the state. And we're gonna get through this.
Good, thank you.
That's it.
I asked Tammy one quick question.
Uh-huh.
What was the percentage of the turnout for the election?
Oh, I was afraid you were
No?
gonna ask me that. I didn't even look at that.
I know it's low, but I was very curious to how.
We had
how low it
more
was.
absent voter turnout
Mm-hmm.
than we did in person.
You had
Oh.
bigger absentee?
Yes.
It was close to 70% in a couple of communities.
It was overall, the county was less than 30% of registered voters.
Okay. I
Inland
looked
was
at it
about,
already.
inland was about 25%.
It was
And
probably the highest one.
well over half of that was absentee.
The way of doing things.
Yeah, I know with Crystal Lake, it stuck in my mind. Crystal Lake, they had 68 in-person people and they had 262 absent voter. I mean, so that's more people are going to absent voter.
Tammy already has this out on the website, or it's just so you know.
Mhm.
Okay, I
Yes,
appreciate it. I just,
the official results.
I
went
like
up
to
there.
put her on the spot.
All right, that's it. I'd look for a motion to adjourn.
So moved.
Second.
Motion's